the healthcare system in our country has been regularly termed a crisis.
I would not say at all that the health system is in a crisis. And I know it's used a lot by the opposition and everything is a crisis. Crisis is a matter of perspective. We have good doctors, good nurses. Yes, our facilities are not so good and we've been working to improve that.
No, it's trash.
Well, I wouldn't go so extreme. There's an unfortunate analogy being drawn between what a drill is. We're not a Google government. We don't go on Google and run country. We have to go by the science and what the facts say. And I say, boss, you have to carry me go to the doctor, the hospital. Him say, where the hospital there? So I said, that way. He was fine.
So your knowledge was intoxicated. Did you help him out with him outstanding traffic ticket?
Why you love to ask? Hold on, you turn lawyer for me now. I never know that this program was a legal program. You know?
Accused of extramarital affair.
As I said, we live, we aspire, we learn, and we strive to perfection, but rarely gets there.
What was the follow-up from your wife?
Oh, Lord. You go too far now. You go too far. I think we need to end the program.
How about that?
Yo, people, come back to the Fix Podcast. It's one hour here with Ari, Javi.
Hi.
I will have a wicked cyclist in the building.
Speed up.
Speed up. I play speed up. Before we get to that, we have to say big ups to at least person. May I big up Casey and Oibin from KFC. Big up yourself. And Mother Teresa, you know yourself too as well, right?
Oh, big up Janice and Olivia from Manapa. Look how long and big them up. Big up yourself.
Manapa, KFC,
Yeah.
Okay.
they love us
There you
there.
go.
Oh, sorry, you eat caves?
I don't think it can be a record saying that him eat KFC.
You don't eat the national dish of
They're
Jamaica?
lovely people. Of course I do.
Which is KFC.
But you know, they have a good menu.
Yeah.
I mean, I love the salads.
It's a
and
very,
the-
yes, the salad.
The
Yes.
salads.
Salads are amazing
Are
at
You
KFC.
can get a fish sandwich.
Yeah, them have the
Yeah,
green
fish
tea.
sandwich. So yeah, I mean,
Nah, barbecue.
it has
steak,
something for everybody. Put it that way.
Which
How's
is
that?
right.
Exactly.
You got Volta as well.
Yeah,
Volta.
yeah,
For the merch as well. Shout out. As I said, people have a wicked man in the building, a wicked cyclist in the building. Wicked man, Chris. Minister.
He said we could call him
He
that.
said that, by the way. He gave us permission.
Like, give him a
The
proper
Minister
intro.
of Health and Wellness.
Yes.
Minister Christopher
Doctor.
Tufton. Minister Dr. Christopher Tufton in the building.
Thank you.
The honorable.
The honorable.
Yeah.
I left off that as well.
Tufton.
Okay. Well, the titles be too long.
Yeah, you know what's so weird? Because I'm like, how I know protocol is very important, especially in especially on the office of the Prime Minister, where you have to address people by their proper titles. But like, how important is it to you? Because I'm sure your constituents are like, Mr. Tufton or Chris or
Can I give you a story?
Yeah.
When I did my doctorate, which took me 3 years, 3 months, and 29 days.
wow.
Yeah, that's how anxious I was to finish.
Okay.
I was on cloud 9 for the first day. After they say I was Dr. Tufton. After that, it never really mattered. So titles are for official events and they have to be respected, I think. But in terms of general life, it really don't matter.
It don't
as long as
matter.
respect is due, I respect you, you respect me. Call me Chris. Wicked man Chris is a designation of the streets.
Okay.
And since
Yeah.
this program appeal to the streets, you can call me Wicked man. It's all right.
You got the name in the streets and it's
Well, it's a long story how I got it, but
I feel like he's a constituency. They promised him a farm or a cat and he never get the farm.
no. It was a more controversial issue. I'm surprised you don't know about it, but I will give you the details of
Oh
it.
wow. Let's
Wow.
Google it.
But there was
Yeah.
actually a song that articulated some of those things.
Really?
Yeah.
Oh, that miss
Check
sweet.
out Aishana during COVID. On lockdown.
Oh, yes. Yes,
But
really.
you can't
Yes.
play it on this program though.
Why not? I mean.
This is the program.
Oh, yes. Oh, yeah.
Yeah, let's start with COVID because I feel like, so many people was hating you, the Prime Minister, just the police, everybody. And it's just like, how are you able to navigate that? So that you have a book, Wild Flavors, an insider account of Jamaica's journey through the crisis of the COVID pandemic. Get it?
Thank you. Yes.
Right. Like, but how was it for you? Because I'm sure that was the first time you were probably handling or you probably encountered a crisis.
Well,
of this
for all of
magnitude.
us, I think globally, it would have been the most severe crisis that the world has seen
Right.
in 100 years.
Right.
And certainly, as health minister, I was the man on the bridge. And there was a lot of unknowns. So you kind of had to play it day by day. But yes, you're right. You had to make some really tough decisions. You literally had to deprive people of their right to movement, their right to freedom of choice, whether they want to go to this supermarket or that one, depending on their age group and their vulnerabilities. Aging, older people over 65 had to stay home. It was tough. And, you were driven obviously by trying to ensure that lives are protected. So there was a good cause for driving those decisions. But after a while, everybody initially fear. Then after a while, people decided that they would rather take the risk, but they needed their freedom. And that's when you had a lot of challenges just controlling people. So it was a tough time.
Yeah.
Tough time.
Did
And
you
on
ever
politics-
regret your? Did at any time you say, "Man, couldn't have been like health minister," like
I actually, in retrospect,
or education minister?
I'm extremely. I believe it was an honor for me to have served at this time because it is a defining moment in our history. Obviously, I had a team, Honorable Prime Minister, who provided guidance, cabinet. The country actually had to buy into what we needed to do. And, but yes, there are times when you had to step back, reflect, and wonder whether you're doing the right thing or not. And there are many of those moments, quiet moments and challenging moments, put it that way.
So I have asked you because, everybody knows politics isn't easy, and one of the biggest reasons people avoid it is fear of being judged and disliked. So how you personally cope with the criticism?
After a while, you get to appreciate and understand it from different perspectives. I mean, today's world, everybody have an opinion. And with social media, as you know, free media, everybody's an expert. And COVID was a big manifestation of that.
Yes.
No matter who you are, everybody had a cure for COVID. You had to just kind of maneuver through that, and you take them as they come. You try to flesh them out to determine what might make sense and what probably doesn't. But you try to respect everybody's views and try to manage it in a way that try to get your views across. I know that sounds very
Because I'm like, respect everyone's views. Like this is a hoax. This
No,
isn't
because
real.
everybody have a right to talk,
Yeah.
but that don't mean everybody talking what is likely to result in a solution.
Right.
But to suppress expression could mean a more aggressive response, especially when people are under stress. So there is a psychology to the process that you have to kind of allow people to vent.
Yeah.
And from that perspective, I've learned to kind of accept criticisms. I don't always like it. And sometimes I go behind the curtain and I was going to say a few choice words. I probably would like to express them publicly. But
I feel like say one of the moment there was when the reporter asked about cheating allegation, like you hold it well.
Well, no, you know why Wicked Man Chris came about. I thought you said it, but no.
Say, forget you.
Well, again, I thought that was inappropriate. But again, in this world where you live in, you realize that everything going to come at you and you have to just deal with it. I've been in politics for maybe 25 years now. So after a while, you learn to accept the good, the bad, and the ugly.
Yeah.
On the same COVID topic though, because I wanted to commend you. I felt like you did a good job during the pandemic.
Thank you.
And we were informed. We got timely updates, and you managed to maintain a sense of calm in the country. So I was wondering, like, what was going through your mind? Like, was there ever a time when you were panicking or nervous, or your initial reaction to patient zero being in Jamaica?
Right. So the book articulates a lot of that and my thoughts. I think my training has a lot to do with it. I have, apart from degrees in marketing, I have degrees in management and in international business, and I'm blessed for that, and I give God thanks. So that kind of helped me to understand human behavior. So there's a discipline that you have to apply to that. In dealing with the decision making around crisis, you really have to ensure that if you're leading in crisis, you cannot show panic. Because if you show panic, everybody else is going to panic. That's one. And you really have to communicate, because when people are uncertain and face the uncertainties with a sense of risk and fear, you have to provide information. And more so in an environment where everybody talking on social media. And then thirdly, I've always tried to be driven by the science, what the science is. So people come with all sorts of anecdotes. Maybe it works in some ways. I mean, a man say, you drink this bush tea. Or one person said, if you put alcohol in your mask or salt, it will kill the virus and so on. So we have organizations that we work with, the World Health Organization, Pan American Health. We in the ministry have technical people. I'm not a clinician, so I work with the clinicians. And what I watch how things evolve globally, what the science is saying about it, and I allow the science to guide me in terms of what I say. How I say it is a function of the culture. So some of it may be expressed in a particular way. Sometimes you engage and solicit others to help you to express it. But I'm a very big believer in communication. I mean, I taught that at the university, by the way. I was a marketing lecturer at UWI for many years. So that I believe helped me. It was not purely a scientific response. It was about touching people's emotions, getting them to understand and appreciate. And it worked to a large extent.
Right, because my question to you is, like, when you see certain, like, as you mentioned, like, people have their own special way of dealing it, and I think one of the biggest things too, where many people thought that this thing isn't real and it's just like a ploy for the governments around the world to control people. 5G had to do with it. Like, what were some of your biggest, I guess, frustration when you know the public's response or lack thereof to the crisis? Like, what frustrated you the most?
Well, that theory about a grand conspiracy clearly does not match up to the data. My biggest fear was to be overwhelmed by the virus, as was the case in countries that are far more sophisticated than us. You may recall in places like New York, they had to store bodies in ice skating rings and in deep freezer containers, trailers.
A big burial plot for
exactly. And these are countries that are far more sophisticated, have a lot more resources. In Italy, for example, where they allowed the virus to just go free, and it created a wave through the country. A lot of senior citizens died because the virus attacks the immune system. And if your immune system is vulnerable, if you have cancer, if you have some kind of underlying condition, or if you're aged, it affects you more. So we took a very cautious approach, because I was always fearful that if it just was allowed to run rampant through the population as a novel virus, because that's what it is. As a novel virus, meaning it's new, you are more vulnerable to get it than when it is in the population and you build up natural resistance to it. So the world was experiencing that novel exposure, which means that it would kill more people, to be totally frank. So that was a big fear of mine. When the conspiracies about I don't want to take vaccine and so on, it irked me most when doctors said it. And there were a few doctors who challenged the approach and the response. And maybe I'm unreasonable. I don't think I am, but I'm saying, boy, if you go to school and train to be a medical practitioner, and you're learned in the science of medicine, why would you come out and say we must take the vaccine? And you know, and they bring a lot of credibility to their argument because they are trained in the field. And there are some of them who had that, or they had alternative theories. You know, there are those who are talking about this particular medication works versus that one, when the general expert opinion coming through multilateral collaboration may say differently. So those were frustrating to me. I'm not a clinician, so it challenged my authority and those who were advising me, and that made things a lot more difficult.
Because I mean, we know that there was a strain on the public health system at the time, because there were a lot of people who had secret parties. We know about them. You know about them.
I know about them. Some very popular people too.
Had secret Yeah, yep. Big up yourself, lad. No, but
No, we love them still, you know.
We love them
And we
still.
understand what's
Yeah,
going on.
yeah.
But yeah, at the time it was challenging.
Yeah.
There's a chapter in the book that speaks to Mocha Fest.
Yes, yes.
And I remember very clearly, someone called me and said, but, you know, Minister, you locking down local parties and you have this international group down in Negril having the biggest whatever, you know, festival. And to be totally frank, we had to act. We've sent the police go lock it down.
Yeah. So you guys were you guys aware of it initially, like being held?
I was not, but subsequent to the event, I understood that it was being promoted online, and it created a credibility challenge for us, because once that happened, then the other set, it created a kind of
a class thing.
A class thing,
Yeah,
exactly.
because-
Why should foreigners get that chance and locals want to have them little round robin in them community, and they are being deprived of it?
Yeah.
And we literally allowed a little time for that. After that event, there was the Jamaican equivalent party in Western Jamaica. What do you call it again?
Dream Weekend.
Dream Weekend,
Yeah.
right. So Dream Weekend came after that. And frankly speaking, we literally had to allow the man who have a shop to do him round robin. And my position was, as a government, we can't afford to just have some people have certain things and others don't have, because everybody is suffering and we must suffer together and weather the storm, or everybody get an opportunity.
Yeah.
Of course, needless to say, right after that, we had a spike.
That's what I was saying. Like, how frustrating was it when you're trying your best and people flout the rules, but they still expect the system
to protect them.
to help and provide help, when you know that, well, we all know that it's strained. Like, how
I
frustrating.
face that every single day in public health. Every bike man in certain parishes ride without a helmet.
Yeah.
And them drink rum and ride without a helmet. To the point where them have head-on collision. Westmoreland is famous for it. I love Westmoreland. I love the people. It's the bike accident capital of the world.
Wow.
St. Elizabeth is number 2.
It's also the AIDS capital.
Well, yeah, possibly. But
According to reports.
According to reports, really,
yeah.
yeah.
2 bikers come head-on collision, no helmet, and they expect to go to sub-hospital. And the system must just cure them overnight. And I said to them, I talked to them and I said, why you don't ride with a helmet? You'd be better off. So boy, the helmet uncomfortable, this, that. So, in other words, lifestyle is a big cause of health-related issues right now.
Yeah.
And all of us live vicariously to some extent at some point, and then end up wanting the system to respond. It's a challenge.
Yeah, it's a challenge. So final thing on COVID though is like, is the ministry monitoring the effects, like psychologically and physically, of COVID? Because many people got it. We all got it.
We all got it.
Yeah,
Did
well,
you get it, Javi? Twice.
Yeah, I think that you were the first one to give it first. I joke. No,
Well-
but yeah, and the vaccine, like, are you
Yeah.
monitoring? Because I'm sure, because they were concerned, like, you know, the long-term effects of COVID in and of itself, and of course the vaccine.
Well, we had a low vaccine take-up relatively, about 30% of the population. But we also had a low mortality rate. Jamaica did better than most countries, a lot of countries in the world, in terms of death per capita. I suspect that the primary healthcare system was a big cause for that. Our nurses in the field, the health centers, we went out a lot and helped people to overcome some of the challenges of risk. The after effects is real. Mental health is a big problem right now.
Especially the kids.
There's been a spike in that because a lot of people had to endure isolation. And isolation led to a lot of things. And the re-socialization of children who were out of school for a long time.
Yeah.
Antisocial behavior, fighting. They don't know how to solve problems without getting physical. Older population also suffered because of the same isolation and lack of movement. So some of the chronic illnesses.
Oh, says like them lost atrophy or something.
Yeah, exactly. So we have had to be dealing with that. So we have provided support, expanded some of the areas, and we are looking now at trying to measure the true impact.
Okay.
But if you look at other countries and the data coming out of other countries, mental illness is a big by side effect of the COVID response, and the other would be some of the chronically ill which went out of control because people weren't going to the health centers and so on.
Wow.
When you look back on your first day as health minister, what's something you believe you understood from the bat, but then over time it did prove to be more complex than you did expect?
I knew nothing about health policy, or certainly not much, not enough when I became, as I say, I'm a social scientist. So I understand human behavior. And when I read the first brief, I quickly realized that the problem in health is not so much clinical. We have good doctors, good nurses. Yes, our facilities are not so good, and we've been working to improve that.
No, it's trash.
Well, I wouldn't go so extreme. We can't take you on than that. Well, not over the last 9 years under this government. We have seen a lot of improvements. But I get you.
Yeah, we'll get more into it.
Yeah, we will. Yeah.
But what I discerned, and that it is proven a lot more to me in time, is that the issue is more about behavior than it is about medication. Because 70% of deaths in Jamaica are caused by the choices we make, the lifestyle choices. Whether trauma is the most extreme. People kill people, shoot people, domestic violence. But the top ones are cardiovascular disease, too much salt, too much sugar, too much fat, smoking, alcohol excess. Yes, that's just the reality. And I'm not. But you know, one of the things I've done is try to moderate the message, because life is really about balance.
True.
Yeah.
So I'm not telling anybody. I mean, I would be a hypocrite to tell people that they mustn't drink, because I take my little drinks.
You could have taken a drink.
Well, I've never had any of those.
We could have never
Never had any of those. But I drink. I don't smoke. But the truth is, excess of any of those. But the same could be said for salts, sugars, and fats.
Yeah.
Trans fats, salt give you hypertension. Hypertension is probably number 2. Lead to high blood pressure, which leads to strokes and so on. So I've learned that we really need to spend more time giving people an option, helping to nudge people into healthier behavior, which is why Jamaica Moves was created, by the way.
Very successful.
And some of the other programs,
Me have asked you though, do the jabs about you not being a medical doctor from people within the medical field, they get at you?
No, of
People
course
say,
not.
I'm not a real doctor, so I'm a...
Yeah. I've gotten that, so I'm not a real doctor, But I did work for my doctorate, by the way. I'm a doctorate, not a medical doctor. But no, and as a matter of fact, can I tell you, I think it gives me a better perspective.
Really?
Because the portfolio, like any other, is really about managing and coordinating the forces that address the particular problems. So it's more important to understand the need, how you segment and how you position within that need. By the way, that's a marketing lecture, which I used to do, right? You look at the market, market of sick people. You look at what kind of sickness, you segment the market, and you look at how you target which segment with what kind of service. So it's more about managing the process than it is about knowing the actual science of how to write a prescription, because you don't need to write a prescription. Ministers don't write prescriptions.
So you think if you were an actual medical doctor, like it really wouldn't matter how good you are at the job, no?
I don't think so. I mean, we have had ministers who are medical doctors. We have had ministers who are lawyers. One of the I think myself and John Jr., who is of the PNP side, are probably two of the longest serving. I'm actually in my 10th sectorial now. I believe probably the only person who's a little longer than me would have been Eldemire, who served many, many years back. And John is a lawyer. And he seemed to have done fairly well. He stayed in the job for a while. So I think it's a non-argument. People are allowed to express themselves, but it's a non-argument.
You wanted to go back to agriculture because you were also successful there.
Well, that's a good point. I was never an agriculturalist.
I know.
Right? No, but I did a short stint in industry, investment, and commerce.
Yes.
And I'm trained in that.
Okay.
So I have an international business business doctorate
Yeah.
and a marketing degree. So that area I could readily appreciate because I studied it, but it didn't matter.
So when the prime minister said, "Okay, all right," so I'm sure he calls you Chris. So he's like, "Chris, your health."
Yeah.
You're like, I'm not. Can just give me back. Isn't that? There's no conversation.
Well, look at it this way: how our democracy works. You really don't question the prime minister when he decides to assign
But
your
that's
portfolio. You
democracy.
allow his wisdom.
That's democracy.
Yeah, you can have a conversation, and you don't have to accept it.
Yeah.
But one has to give place some faith in his wisdom to see how he wants to set the team. And let's face it, I'm the captain, right? That's how it works. And the captain decide who feel where. Now, if me go there and drop the ball or get out through the stumps, then he also has all right to say, boy, you're not qualified now.
Bench.
Exactly.
Wellness bench.
The fact that I've been there for 9+ years,
Yeah.
maybe nobody else want the job, who knows?
And then see how much fire you come under more time.
From doctor, nurse,
Yeah,
communities of
everybody.
protest. Oh my God.
There's a crisis around every corner with health. I mean, we have 23,000 employees. We have 325 health centers. We have 24 hospitals. And each year we have 3 million visits.
Yeah.
And every single Jamaican, no matter how wealthy you are, if you have a plane to fly up to Miami, if you have a trauma, we have to stabilize you here before you go. So there's hardly a Jamaican who has not or is not likely to interact with the public health system. So it makes it very important. And from that
much so.
perspective, it's an awesome job. And I'm honored to have the opportunity to serve.
You mentioned,
Earlier we mentioned mental health. And I wanted to ask about the wellness bench. How did it even come up with the wellness bench?
yeah, whose idea was that?
All right. None of us can claim paternity for the idea or ideas. They evolve over
why was
time.
it
But this was
I think you have to claim because you're the head.
well, speaking of paternity, I mean, we need some young people to have some children.
Oh, we are talking about that.
We'll talk about that.
Yeah.
Yes, this is the woman name of the
I
problem.
want to question you three about that. Not me, but I want to question you
Except
three.
me. I'm
She
She
gone
has for
three.
all of us.
Oh, you gone through
I
already?
am.
She got a hot chick already.
Wow.
Twins.
I think you could have another 3, but that's another issue.
Yo, you feel her husband head with a bag of ideas.
Her husband doing well. And she's doing better. So, anyway. The wellness bench came out of a UNICEF PAHO initiative around mental health, which we fully embrace. As I said, mental health is a real issue post-COVID and in the young population schools. So it initially was targeting the young people in schools. And it's symbolic, although it's tangible. It really is about the concept of safe space and safe person. So what we do, we go and install. It's a nice seat, but can only hold 2 or 3 people at a time. But what we try to do is to say, listen, this represents a safe space. If you have a problem, find a space. Where is your safe space to kind of absorb and to try and solve or resolve that problem, as opposed to always being tormented by the problem. It's interesting when you talk to the kids, I'm telling you, my safe space is in my bedroom, on my couch, under the mango tree. I can just relax and just unwind. The other thing is a safe person.
Right.
So what we do, we encourage young people. Who is your safe person if you have a problem? You need somebody to talk to.
Yeah.
Don't just keep it in yourself. So we question them about that. They said if safe person, maybe the form teacher, maybe mommy, maybe a community leader, maybe the pastor, maybe
Nurse
somebody at the
tree.
choir. Huh?
Yeah, mine is my tree.
Till the tree dead.
You're safe. Well, your safe person can't be a tree though.
No, well, it's my safe space. I talk.
It's not
Oh,
a
you're safe.
I talk to the
place.
tree and the tree talks back.
No, if it works for you.
Yeah.
Just don't keep talking after you leave the tree. You might end up down that gap.
People are a premium.
No, but it's important. And I tell you, nature is a safe space. I mean, I enjoy walks. I walk almost every morning. I go gym and then go and walk. And I love walking by myself because that's when my thought process, I'm just in my zone, in my space.
Yeah.
And when I do that, then I can confront anything after that. So it's actually a good thing that you have a tree.
Yeah.
Is it green or?
It's very good.
You mentioned a safe person though, because I remember there was an incident at a high school, like a student was suicidal. And I'm checking if you still do wellness checks at schools, and who would the safe person be for them at school.
Right. So most schools would have a school nurse or a guidance counselor. And outside of the form teacher, I guess it depends on the level, whether it's primary or high, who you probably would interact with most times. Students and teachers develop particular relationships. You may feel like you're more comfortable with a chemistry teacher as opposed to a math teacher. But invariably, the school nurse or the guidance counselor are places you can go for some level of support. You should be able to go. So that would be what we would recommend. But from the health ministry's perspective, we've been training teachers in schools to discern troubled children. Because one of the problems with one of the challenges we face in Jamaica is that we tend to see antisocial behavior as deviance, bad picnic kind of thing. Not that this is a troubled child who needs support. So what we have done is provided training. We've trained quite a few hundreds of them. Once they identify that scenario, the guidance counselor should be able to naturally identify that, and the school nurse, because they are trained naturally for that. Then we can refer them up the channel, whether to the health center, all the way up to a psychiatrist. So there is a relationship between the schools and health.
When you started to say the memes about the wellness bench.
Huh? Yeah, man.
Did the thought cross your mind and say, this backfire, them think it's stupid, got it now work, them are ruining it. When you saw the memes, what do you think?
Now, I tell you something, but anytime people start to make memes about any scenario, it probably is a good thing because it get out there more and it circulates and the communication is real. No, the truth is we all need a wellness bench at some points in our lives. And I tell people that every single one of us at some point will become mentally unstable, if even for a minute. Knock wood, yes. I prefer I prefer just for a minute. But the truth is, life can be stressful, and circumstances can stress you out.
Can be like this.
Definitely.
Right. So it's important to appeal to people, and no matter your age. And by the way, I keep telling people, this is a stigma that's attached to mental health, or we have to break down. Mental health is not confined to the man on the street who is homeless. It is in the corporate office. It is down on the shop floor. It is with the child who is 10 years old. It can affect all of us. In fact, the study we've done suggests that 40% of our population at some point in their lives will have a mental health scenario. Whatever it is, it could be anxiety, it could be any of those things. The good thing is that, so we have to look support, and we have to be willing to seek support, and you can recover from it, and that's a positive thing. So it's a message we need to get out there.
Yeah, because I realize that it feels like each year your ministry focuses on something. Some health aspects. So whether first it was Jamaica Moves, that was the biggest campaign, getting people to move, and it was like sugar, like looking at the sugar intake, and of course mental health. So is this something that you guys plan out, like where each year, I don't know, or each quarter, or each
period,
you guys look at different health concerns in the society and tackle them?
It's really a communication issue. The truth is, the Ministry of Health as a portfolio has always tried to promote these best practices. Where I'm a little different is, again, because of my training. I believe the art of communication is to get buzzwords and to brand. So essentially what I've been doing or tried to do with my team is to suggest concepts that we can brand. And we have done more branding in health and during my tenure than any other time. So Jamaica Moves is a very simple philosophy, It's really tapping into Jamaican culture, music, dance, and promote physical activity. So when we're hosting these events, I remember the last one we had in Portland, the big one, we had nearly 5,000 people in the park.
Wow.
And we never gave anybody anything but water. There are a few guys around the periphery who were smoking herbs and spices. But outside of that, there is no food served, and they worked out for 5 hours.
Wow.
Then we have Better For You menu right now. We have Know Your Numbers, which is really Better For You is say, look at the menu and you see a green tick, which we have inserted, and pick the ones that are better for you. We have Know Your Numbers. We have Second Chance Smiles, which is an oral health program where we give free dentures. But in the meantime, we teach people about oral health, brushing your teeth, going to get a checkup. We have New Limb, New Life, which is really about diabetes. 95% of people who lose a lower limb in Jamaica lose it because of complications from diabetes.
Wow.
And diabetes is a huge problem, right? So while we are giving them a prosthetic limb, we're teaching people about it restores you, hopefully, to normality somewhat. But then you have to understand the complications from diabetes. So I try to do that because I find that naturally we catch phrases, and it's not just about reach, it's about impact and trying to get people to adopt.
As you mentioned that, Dr. Tufton, one of the common criticisms that I hear about the Ministry of Health and even the government at large, even though branding, marketing, promotion is great, and we see that it's been done to a level in which we've never really seen before. People would have the criticism to say that it seems like they're focusing too much on marketing. So when coming up, so when coming up with plans, strategies, policies, do you have a mindset to we need to achieve a certain balance with the marketing, but also with the action as well, so people can actually feel.
Right. So we have been accused. I certainly have been. I'm called the PR minister. The opposition do that all the time. And others, my detractors. I don't mind. I don't mind because I don't have a problem. I don't say PR. I say communication.
Yes.
Good public health requires an effective communication machinery.
That's true.
If people don't know, there's no chance that they will do, right? And I don't make no apologies for it. We have to communicate. COVID, we communicated a lot, and I think we're better off for it. And similarly with the other programs. What I will say about communication, though, it cannot be an emptiness. It has to be substantive. It has to be backed by something. Now, let's look at the facts. And I don't want to bore you too much with it or your viewers. We pushed hard for more people to go to health centers than go to hospitals. We're now seeing the success of that. 300,000 more visits to health centers and hospitals. Why? Because life is about prevention before you start to cure.
True.
And that's why you have crowd out to hospitals. We have seen nearly 300,000 tests under the Know Your Numbers because we pitch it in a way. People come off the street, we set up in the town centers. We have moved people from the town center to the hospital because their blood sugar level was so out of whack or their hypertension.
And they didn't know.
They didn't know, right? So my view on it is that if we save one life by communicating and getting people to do certain things, we are making a positive difference. But I do agree with you that it's not just about communication. There's a lot of substance behind what we have been doing to back up the communication.
Right, because I think to piggyback on what Nara said, is almost like you guys focus so much on the branding and the PR and like, the fanciness of the communication, but like, have you really seen any real life success in the policy and the communication where you can track it and say, well, we communicated, but as you said, like less people.
Well,
are
I tell you,
diabetic
I give you a couple of examples of why I think so. When we did the 1-year sugar campaign about sugary drinks in schools, and it was a campaign led by the Heart Foundation, supported by us and funded by a philanthropic group out of the US and also some local funding. It raised a lot of, there are some people who were offended by it, especially some of the drink manufacturers.
Okay, yeah.
The truth of the matter is that to feed a child in school with an overdose of sugar or sugary substances turns them into the energy level goes like this and it goes like that.
Just a Tasmanian.
Yeah, little monsters.
Exactly. And it compromises their learning capacity.
Yeah.
It's scientifically proven, right?
True.
And
They crash out.
what we did was to create awareness. And at the end of it, we introduced a restriction on sugary drink. People were actually calling for it because of the awareness program. The other point I want to raise is that if you think lifestyle is your major issue, and lifestyle is influenced by marketing campaigns, of one form or another, and highly successful marketing campaigns with a lot of money put in it. I know, 'cause I used to be involved in it. That's my discipline.
Yeah.
You can't respond from public health perspective without similarly sophisticated communication, because what would happen is that you'll be swamped. So if you want to do an anti-smoking campaign and they're spending hundreds of millions of dollars, you can't just talk about it and say the science of it say. People don't relate so much to the science as they relate to how you manage the perception
The emotions.
and the emotions. And so the appeal has to come. So I have always felt that government programs in a particular context must be backed by proper communication strategy. And maybe it's a bias because of my discipline, but in health, I think it's more important perhaps than anywhere else.
So I wanted to get a better understanding on what you mentioned earlier about the 300,000 more persons going to health centers
Right.
in 2024. What's the reason behind that? Is it that the health centers are in a better condition than the hospitals? Like, what's the real reason
All right.
for that?
So to understand it, we quickly understand why people go to hospital. People go to accident and emergency because they have an emergency or they have a perceived emergency. Your head hurt you is your experience. You think that you're out to die. When the doctor check you, the doctor say, boy, 2 Panadol, you're good. You can go on. Or you really should go to the health center. They bypass the health center because they don't think the health center can give them the service. Now, they don't think so because either the health center is run down. It just look horrible. Or no doctor not there. Or they just genuinely don't offer those services. So what we have done over the last 5-6 years, we have refreshed our health centers. We have built some new ones and we clean up the old ones. We paint them, we put in air conditioning unit and so on. And so when you go there, you get a sight. It's a nice feeling. You can sit down and feel more comfortable. We have added more doctors in our health centers and we have added more services. So 5-6 years ago, you had 1.6 million visits, and I say visits, not people, to health centers, 1.4 million visits to hospital, or almost 1.5 million. So about 3 million on average, a little over that, visits. Last year, we had 1.1 million visits to hospitals and almost 9 million visits, or 1.8 something million visits to health centers. So there's a definite shift, which is a big policy success because you really want to keep people in their communities. You don't want them packing up down a Maypen accident or Mandeville or KPH or whatever. Unnecessarily, exactly.
Okay, so it's like that's more of a strain on the public, like the public health system versus
It puts the emergency under stress. Because emergency services are limited to emergencies.
Right.
So when you triage, which is the process of a man come through the door, you examine him, what's your problem, and so on. If he's not perceived to be an emergency, which is normally about 30% of the time, they either tell you it's not an emergency or tell you to wait. Either of those responses frustrates you. Because you think it's an emergency, right? Because it's your experience. A man come in with a heart attack, God forbid, or a stab wound. If you are there 4 hours before him and just about to see the doctor, and then pushing a man with blood up on her, they push you back and take the man who is blooded because emergency triage give priority to life-saving circumstances. A lot of Jamaicans think that A&E is first come, first serve. It's not. So it can be very frustrating.
Okay, so if you go to A&E, if you're like you're bleeding from an orifice or you're about to die of a stroke or a heart attack, that's the priority. So health centers really look at people if you like, as you say, you know, you probably have a headache, you're not feeling well, and then they would probably escalate it to say, well, you're on the verge of a heart attack, go to the hospital, things like that.
Exactly.
Okay.
On chronic cases, you know, people who are diabetic who need to go for their monthly checkup, get their monthly prescription, that kind of thing. Diabetes gives sores, so dressing up the sores. Cuts and you can't get better. It's hard to get better. So there are a lot of those cases that have to go, and it's best that they go to the health center to get it sorted.
You know, I was wondering, like, you know, I think it was Bruce Golding implemented, former Prime Minister Bruce Golding implemented free healthcare and free education, right? And, you know, I think that was one of the major concerns. Like, you know, yes, it's free, but can we afford for it to be free? And I was wondering if that is something that you guys looking at in terms of revamping. Like, should the public start paying back in order to improve the infrastructure and the services of the hospital?
So first of all, I know the communique it says free, but there's no such thing that's free. The question is who pays for it.
Right.
Indeed.
And you don't pay at the point of access, which is why we say it's free. You pay by taxes, and taxes vary, and in some instances through subsidy of certain things. But the reason why the government of the day, or the party at that time, campaigning for government, and I was very pivotal in that, was because there were too many people being denied access at the point of access, because they had to be sent to a registration window to pay down $500. And some people either never went or just couldn't afford it.
So they have, meaning they had to pay first before they see the doctor.
Exactly.
Oh.
Prior to the free designation, you had to pay before you access. Now, it wasn't a great amount, but depending on who you are, it could have been a great amount. And some people were denied. And there's a principle in health called universal access, where you should really not deprive anybody who wants healthcare. So we subscribe to that principle. So the free became designated, and we stopped collecting. We collect from people who have insurance now, by the way. Yeah. If you have a private insurance card and you go to the hospital, we'll take from the card, but not from your pocket.
Okay.
And then we had to increase the budget to finance that.
Right.
So what we're struggling with now from a government of the day standpoint is how do we ensure quality access? Everybody have access. How you ensure quality access? And what that means is that we have to apportion more of the government taxpayers' resources to health. But we also have to cauterize the demand for health, because two approaches you have to take. One is to cut the demand or reduce the demand. And the other, of course, to cure people when they get sick.
Right.
Which is why the lifestyle thing is so important. Because if people live healthier lifestyle, if everyone would get up a morning time and do like a 2-mile walk, yes, and eat a little more carrot and vegetable rather than just the rice and the gravy, and decide to drink one less drink on a Saturday evening, it may mean you may end up at the hospital at 72, not at 65.
Yes.
If you understand what I'm saying.
So I guess the question was, or should be, can Jamaica ever achieve universal healthcare? Or what else can be done to achieve that?
Well, I tell you, we have, in that people have universal access. There's nobody who goes to, sometimes it's hard, but you do it because you're committed to it and the principle is in place. A man who just, God forbid, shoot an innocent man and him get shot in the process, and the two of them end up at the hospital. The two of them are going to be treated to save their lives. Some people argue, boy, he's a criminal, but that's the way the system works, and we don't discriminate. We don't judge. We just save people.
Yeah.
So that is guaranteed. What we have to do to the point is that we have to find the resources and manage the resources in a way that ensures that if a man wants a surgery, he can get the surgery. And if he need a prescription, NHF has done very well. He can get his medication, but also reduce the demand for those medication and for the accident and emergency.
Right. Because you speak on like classism, because so many people who are, well-to-do would either go to private healthcare, or if they're very well-to-do, they will leave Jamaica and go overseas. And I was like, especially people who have access and privilege, like ministers, do you guys face the health system? Are you guys very much aware?
I have done many procedures within the public health system. I mean, my unfortunate riding incident
Valiant
took me to the university. I can laugh about it now, but it wasn't so funny when it happened. Took me to the university hospital, and I did surgery and restored. I have a titanium plate.
I lie.
Titanium plate. I broke my leg, broke my hand.
No.
And if it weren't for my helmet, I probably would have broke my neck too.
It was that
Oh, so I
serious?
thought
Yeah.
it was only a hand
No.
was that
Broke my leg and my hand. I
All right.
went right over the car.
All right, we'll veer off a little now. Let's talk more about that situation and the incident that happened.
Yeah.
So you were cycling like it was early morning.
Early morning. I'm an early morning guy.
Take us
And-
through the incident.
And this morning I went on my own. I mean, against better advice, but as I say, I like,
because you guys are assigned
I like my own
CPOs.
company.
Okay.
No, I don't care. You know, but I like my own
Yeah.
company. Put it that way. So I go out this morning and was on the way back, and then a car was coming up. Car took a turn. I was coming down, and the collision took place because the way it turned and I was coming down. So I was literally on the car, and it just flipped over.
Wow.
Helmet crack. And then I found myself on the ground and tried to move one of the leg and couldn't move.
Wow.
So anyway, in fairness, I was placed in the car and I gave some directions because I was coherent enough to the hospital.
Who placed you in the car?
The driver.
Lo and behold.
By the way, did you know who it was? Like, did you?
You know, it's interesting. I don't think Valiant would probably not have a problem with my saying it. But at first, I wasn't. I didn't know. Right? All I knew is that the thing hit me and the man came out of the car. This person and said, "I don't want to tell you what he said, but it was
Some
colorful,
colourful
right?
words.
In alarm, in alarm.
Yeah.
And I said, boss, you have to carry me go to the doctor, the hospital. Him said, where the hospital there? So I said, that way. And then he was frightened. He was frightened.
To your knowledge, was he intoxicated?
I won't say anything right now. I can't know that.
Yeah,
I mean,
you
in
can't
fairness,
know.
you'd have to do a breathalyzer.
Yeah.
But you know, I mean, everybody have an opinion. I'm entitled to mine too, but it will be quiet at this point.
Yeah.
So I was put in the car, and while I was in the car, he said to me, "Oh, hold on, you look like one of the ministers there, you know." I said, "I'm Minister of Health." And when he said, "Boom,"
I'm done, so I'm gonna be thrown out of
Anyway.
jail.
so there was a bigger exclamation
Yeah.
because then I suspect he became, and it's natural.
Yeah.
It's natural. And then he told me who he was. And you know, can I tell you something? I don't know, for good or bad. I was actually thinking a month or so before of booking him for one of my summer street dance I have in my constituency in St. Catherine West Central.
Look at that.
So while I carry me go to the hospital, me say, hold on, you know, so me don't think about booking you for one of my street dance.
I mean, you must load up. You must load up for dubs now for this upcoming election season. You
No,
must
not
load up.
really, not really.
You know, have to perform every event.
Event Jamaica.
You know what I should have
Zero.
actually done is hire you as my manager. Because I probably would not get through all of that.
Business,
Yeah.
no.
I probably would not get that. Anyway, the long and short of it, we went to the hospital and the doctors were good. The system worked.
Yeah.
Yeah, everybody says
Who-
because you are health and
Who
wellness.
paid for that? What, you paid for that, or he paid for that? What?
Interesting question. I have insurance, put it that way. And up to this point, is my insurance that has paid. Up to this point. And I got the team, they looked at it, did the x-rays. But can I give you a good part of the story?
Sure.
If there is such a thing as good in an incident like this. The doctors said to me, Minister, and the other decent team, you know, we did all your vitals and you are a fit man. You can go to surgery right away.
Nice.
You
You feel good.
Yeah, my confidence level was kind of, you know, we start to give the thumbs up.
Minister of Health
We said that
working,
walking
yeah.
around, it was a good thing. And by 3-4 hours, I was in surgery.
Wow.
They had to wait on a piece, the stuff to put in.
Yeah.
And then I said to them, you know, listen, I don't want to be put to sleep. I want to be fully conscious with the surgery.
Really?
There are two teams, one working on the head, one working on the hand, one on the...
Why?
And they did a procedure that numbed the area.
Oh.
And I listened to everything they said for about 2 or 3 hours probably. And all I could remember, what is most memorable to me is that while they were doing something with the bone, here one of the doctors said, man, the man, your bone tough, man. And the other man said, you know, you're so tough that you do.
You were aware of that, girl.
Hey, this is what every man want a girl tell him that.
So, but it was successful, and I have to pick up the doctors there because they did a really good job.
Yeah.
Still recovering because the leg
Still.
not functional as you know, after you get to a certain age, it's so easy for you.
Yeah.
Bones, you know. But so I'm still doing some physio and trying to regain the muscle in that part of the leg.
Really,
But
that bad.
it
No,
was,
like for the media really just minister
sustain hand injury. I'm like, that's all.
yeah.
So wait,
So this was
when
at UE?
Yeah, I did the surgery at UE.
when was this picture taken?
That was taken
before our post surgery.
while I think it was after the surgery.
Oh, okay.
After the surgery.
Whose idea was it?
Well, you know, boy, I tell you, it was. You're bringing back some memories, you know, but you know, there's a lot of lessons in it. I think there was a little. Put it this way, there was some concern that, given the nature of what happened,
And
in
who
terms
it
of
happened to.
who it happened to shouldn't matter, because if it happened to anybody, the rules apply and should apply.
True.
And I'm a big believer in that. But clearly, I would have brought more
Attention.
publicity to this situation.
The two parties involved.
The two parties actually, and you know, the issue is how you resolve this, because there's a investigation clearly that has to be triggered into it. I took a position that I wanted to avoid as much of that aspect of it as possible. I mean, he's a young man and I'm alive. I hope the lessons are learned and would have been learned then. And I didn't want to do anything to damage his career and his future, but still wanted him to understand that, you know, if there are lessons to be learned, we should all learn those lessons, put it that way, right? And hence the kind of public display that some people felt and suggested, and I obliged.
I see.
May have been good to do, but yeah, it's one of my famous experiences. Put it that way.
You help him out with him outstanding traffic ticket. Then?
Why you love to ask? Hold on, you turn lawyer for me now. I never know that this program was a legal program, you know.
Like him ask you, like, because you know them that run him license through the system and that they come up to him.
Listen, I wish him all the best. I hope he does well, and I hope that this doesn't happen to anybody else. Put it that way.
The lesson learned here: don't ride your bike so early. Don't
Well,
ride at all.
I don't know if that's the lesson learned. I have to take up for the bikers who ride every morning, but we have to be careful on the road, and we have to recognize that there are multiple users of the road.
Yes,
And
definitely.
we shouldn't take anything for granted.
Scared.
Yes.
I was thinking the weight that I don't think you would have the long wait that a lot of people complain about. A common complaint about the health system is that the wait is exhausting, it's long, and the customer service is poor.
Right.
So our measurements being put in place to improve the customer service.
You know, we have done a lot to improve it, and the interesting thing about how you assess the quality of service is that it's normally assessed through the public expose of disaffection, not so much the people who are satisfied. As I said earlier when we started, we have 3 million visits, and I am prepared to say that 90% of them have a fairly reasonable experience. But it only takes 1%, because we have a tendency, and maybe the system has created that in us, where if we don't get good service, we turn to TVJ, turn to demonstrate, turn to the media, call one of the radio programs, I go up on social media. And every complaint is worth considering and looking at, so I'm not diminishing the importance of it. And it is true that we need to do better. We need to do better. So what we have done is we're training a lot more. We're putting in place customer service reps in the waiting areas so people can talk to you. Because I tell my people that therapy really starts at the gate. Therapy don't depend on the prescription pad or the doctor. When people come in, they are in distress. That's why they go hospital or doctor. And so you have to treat them in a particular way. You have to answer them questions. They have to have a bathroom to use. They can flush the toilet. If they want a glass of water, you must give them. And you'd be surprised how that at least calm the fears before the doctor even see the person.
Yeah.
And we have to get into that habit. And it's a cultural change. So we're working on it. I think it is improving a little bit. I think it needs to improve more. So I'll accept that. In my case, I have to defend myself and you. When I went there, not many people were at ARD. So I was.
Oh yeah, 7 o'clock in the morning.
I was easily seen. I was quickly seen. No, sometimes you go there 5 o'clock and people are there all night. But I had a cubicle that they pushed me in and they dealt with it. So I'm not sure that I would agree that I was treated specially. Although some people would assume that.
Minister.
No, well, I mean, you know.
You can't tell me saying if I get
But
pushed.
fine. All right, fair enough.
This is my boss.
You know, see how that?
Somebody see you and say that in the hospital.
I said, wait, Valiant did it too.
Yeah,
All right, okay. I can't argue that point.
Yes.
Let me not take on that point because I would never win that, right?
You know, the situation regarding the healthcare system in our country has been regularly termed a crisis. You said that the term crisis is too casually used when describing this. So what would you say to the people then who are probably misinformed or worried about the state of healthcare in Jamaica in regards to?
Well, I would not say at all that the health system is in a crisis. And I know it's used a lot by the opposition and everything is a crisis. Crisis is a matter of perspective. I mean, I'm sure people experience crisis every day, either because of their personal condition and they go to health to seek remedy. The remedy is not immediate, then they say the system is in a crisis. What we have to do is work more at helping people to understand how the health system works. And where people experience bad treatment, we have to deal with it. I don't shy away from that. I tell people that there's a mechanism for you to report. In fact, what we have done now is put on almost all the waiting area walls a toll-free number where people can call. And it goes to the CEO. And if it needs be, it can come even up to my office. Because we want to hear from people when they experience bad things. I get WhatsApps weekly. And if I get it about Port Antonio Hospital, I send it to the regional director who is in charge of the parish or the CEO, and I tell them I want back a report the day after. Everybody in Jamaica have my number, almost everybody.
Wow.
So my number, all 3 o'clock in the morning, people come.
Oh no.
Right? But I don't mind, not calls, more like WhatsApps, because the calls become annoying. But it's hard for me to see a WhatsApp and not respond to it. So I forward them to the relevant people to deal with it. So it's a work in progress, I agree. I think it has gotten better. But the truth is, I don't think you'll ever get to perfection because health is just constantly evolving. If it's not a dengue outbreak, it's a Zika outbreak, it's a ZikV outbreak, is something else. It just never stops. And after doing it for almost 10 years and getting a lot of gray hairs for it, then, yes. And
You realize not everything is urgent. It's a problem.
It's a matter how you manage it. And the first thing you do in a crisis is to try to bring some calm to the situation. So I've tried to be very more methodical in terms of how I think through things. COVID taught me a lot of that.
Wow.
I remember when we were waiting on oxygen, when we almost ran out, literally within an hour of running out. I remember COVID is a lung disease, so people couldn't breathe. People would have died, a lot of people. I remember the morning about 1 a.m. when the oxygen came into the country, went to the plant and was distributed. And I sat up the whole night watching and getting the report, going to hospitals that were on the verge of running out. Now that would have been a crisis, a real crisis. So we come close a lot of times. And again, on a smaller scale, yes, other persons have experienced crisis. We just deal with them and try to overcome them.
Speaking of crisis, I went on social media, I saw a crisis to come back. The Cornwall Regional Hospital, it's renovating now. What's the current status of it? And when is it slated for completion?
Right. So Cornwall Regional was a crisis. There's no doubt about
it was
it.
falling down.
Picture this. You have 450 people in beds, some of them very critically ill. And all of a sudden, you're being told that you must shut down the hospital because of air quality issues, toxic fumes coming out of the walls and so on. Which, by the way, never happened overnight. 10 years before, and nobody was doing anything about it. Which is why I said to the opposition that you're as much at fault as anybody else because you were there while I never did anything. Anyway, it collapsed like any of us would or any car would. If you not tune up the car, it will stop drive on you one day. The problem is that you could come out of the car and go take a bus. You can't take people on life support out of a hospital and put them out on the street because they would die. So we had to do things. We had to find a way to literally build a hospital around the hospital. So for example, let me give you an example. We have a nurses' quarters where nurses live. We had to move out all of them, run the necessary mechanical devices like oxygen tubes and so on, convert them into wards so the patients them can be moved from the hospital into the nurses area. That's where the hospital now is, in the nurses area, the nurses accommodation or previously nurses accommodation. We had to create labs to do lab work. We had to create dialysis center. We had to move people out to Mount Salem Clinic, turn it into A&E, and I could go on and on. So there was a lot of build out that took place. And then we said the problem was a ventilation problem and said we'd buy a new ventilation system to install. Well, it turns out that once you got in there and started to dig the wall, you realize that every pipe was leaking, every piece of electrical was corroded, the roof is because the water was coming from the top, going through the walls and corroding everything. So then we just decided to just build, strip down the building to nothing. So we took out everything out of the building. And hence why the time delays and why the rescoping of cost.
Because it says $24 billion and it's 8 years.
So first of all, it sounds bad and it's easy to take a sort of emotionally charged posture and indeed to even politically exploit it. And I'm the politician here, you don't have to say anything, right? But it has been exploited. And it has been exploited because, yes, it appeals to the emotions. But it's a kind of exploitation which I think is reckless because health really should be, we have to be more responsible about how we deal with healthcare. The truth is, the services of Cornwall still exist. Last year they treated thousands of people. The building has to go through substantial overhaul. And the rescoping is how we projected to the 24 billion. But we only spent 9 billion already. The people out there talking about 24 billion, them accusing of overspending and calling 24 billion when the money not spent yet. 15 billion not spent yet, you know. It's still down a BOGR by Ministry of Finance. So, and there are enough documentation to show what has been spent. But part of that is building out around, sustaining the services, stripping down the building and rebuilding it. So when it is finished, you're going to have a new hospital. Now, back to your question about when. We've started to phase reopening. The anticipation is that by April, the first quarter of next year. Now, also bear in mind on timing, which a lot of people miss in the narrative, that for 3 years we couldn't do anything because of COVID. So technically speaking, we have really been working on the hospital more like 4 years, 4 plus. For those 3 years when COVID was taking place, nobody could go on the site because of restrictions. And we were building out COVID wards. We built COVID ward at Falmouth, we built at St. Joseph's. We were focusing on that.
So you had to pause.
We had to pause. We had to pause. So even that is a kind of dishonest assessment of the situation by those who know. I don't mean people who are casual about it and don't understand. But those who comment on it know that this is the case. But they choose to take a different perspective. Part of the cut and thrust of the politics, we just have to
because that's what I wanted to ask you, because it's not just Cornwall Regional Hospital. There are several hospitals island-wide that really needs improvement, you know, in infrastructure, in services, with personnel. Like it's a lot. So is it unfair for people to expect, you know, your government, your ministry, you as the minister, to overhaul and to kind of do the magic one and make it happen within 5 years?
That's a good point, because what has happened over the years is that there has been a suboptimal expenditure on health. So let me just tell you, as the population grew, kind of taper off now and like to come down if you don't have more babies. because of population
No, but
decline.
that's why we're not
It's
supposed
funny
to
that
have
you
anymore.
question that
No,
already.
no,
Our
no, hold on.
resources can't manage
And I
it.
want to take it up. I want to
Like
take on
that.
that question. It's a serious issue, you know. Replacement population is lower than what
Yeah.
it should be. So, in another 10 years, we might be 2 million as opposed to 3 million.
Good.
Why is that good?
Less traffic, you know.
Less people, less resources.
So let me tell you, the population grows, the sick profile grows, and the expenditure on health. So what you have is a greater demand on an existing system which was never built for that number. This government is the government that has spent more on health infrastructure than any other. And I make no apologies for it because the facts speak for themselves. The expenditure budget on building out hospitals and health centers is more than any time before since independence. So as a result of that, if you go to Spanish Town now, you see 2 cranes in the air. I've never seen that in Spanish Town in my lifetime, right? Building a 6-story building on Spanish Town Hospital compound, which will have another 129 rooms, 5 new operating theaters, and I could go on. We're going to do the same to Maypen. We built out Chapelton Community Hospital. We're doing the same to St. Anne's Bay. We're building the Western Child and Adolescent, which is partly supported by the Chinese government, partly by us. And of course, Cornwall is a substantial overhaul. So when combined, we're going to be adding as a government nearly 800 new beds to the health system. Many new operating theaters, I think about 29 or 30. More space at the community level. All of this is trying to right-size what we had as a gap over many years. It's hard to do it in the time that we have, which is why we said third term loading.
You guys think you're deserving of the 3rd term? Really?
Absolutely. Let me tell you, I have been part of this government and with all the challenges, and listen, nobody is perfect and no government is perfect.
All right.
And the truth is, the way our democracy works, it's supposed to have checks and balances to call you out when they think you're not doing something or should be doing something.
Right.
So I'm not here defending perfection. I'm here defending what serves the greater good of the people. And I'm saying to you that from that perspective, this government has done more to create jobs, to stabilize the economy, to build out healthcare, to reduce poverty, to give people more opportunities than any other government that I can think of in my lifetime. In fact, the last time I think there was so much hope about the future in Jamaica is probably the 1960s after independence, when people really were into the national identity and pursuing their own, whatever.
Yeah.
The 70s was a chaotic period, as you know.
Yes, the 80s.
The 80s were extremely
Violent.
challenges for various reasons. And I could go on and on. So, I really hope that the Jamaican people sees it for what it is. Clearly, I'm defending a political organization. I'm sure others have their own perspective. But I am happy to be a part of history now where we have survived a lot and put ourselves on a trajectory to move forward. And I'd like to see that continue.
What about KPH?
Yeah, because I say
because there was
KPH.
a shutdown there as well, and of course there's going to be a new KPH.
Right.
Indeed.
So
So what's the
KPH
timeline on that?
Right. So KPH had a operating theater shutdown because of the ventilation system again, the AC. We have a serious problem with supplier consistency to ensure that these systems work. And operating theaters are very vulnerable because that's where most diseases go to get either cut out and destroyed or cured. So the natural environment there is very sensitive. And if you don't deep clean it and so on, all of those contaminants create a problem. But KPH is a very old institution, 200 and odd years old. And while they've added a lot over time, you have a lot of parts of it that are old. So what we did, we're negotiating now to buy lands in and around KPH. We have established a technical team that has started some technical work to look at how we design a new KPH, ultimately leading to the building of a new KPH, which is well-deserved. It's going to take a few years. So we're doing some internal works to sustain what we have. But we definitely need to, and the government is committed to doing that.
Minister, it seems as if the problem is like, you guys are building new things and you're creating new wards, theaters, but it really seems the issue is maintaining and servicing, which is
absolutely.
always the issue. So why isn't, and it wouldn't necessarily be you, but like why isn't more done, especially with the permanent secretaries who don't change based on the government when the government change, and other technical or technocrats in each ministry? Why isn't more care done to maintain and keep the service going? Because I mean, Cornwall shouldn't have gotten to the point it should have gotten to. KPH shouldn't have gotten to the point it has gotten to. So why is there a lack of maintenance?
I think it's just the way the system has evolved, unfortunately. We celebrate new things and we don't sufficiently realize the life cycle value of what those new things are to bring to us.
Right.
So you buy a piece of equipment, first time it loses a screw, it gets pushed in a corner. And it really is penny wise and pound foolish. So we have maintenance crews, at all the hospitals. But in comparison to what they need to do and the size of the crew and the technical qualification of the crew, where there is a function of not having the people that you need, the truth is it's far inadequate. So what we do, we outsource some of the maintenance. So the combination is what should work, but to be brutally frank, it does not work. So what we're doing now, we're doing some new service level agreements in terms of the hospitals and the regions that says, for example, if you buy a new piece of diagnostic equipment, a CT scan, you have to buy the extended service warranty with it.
Okay, like the drill.
Right, the drill. Like the drill. Exactly.
Let's go into
I know, did you not ask me about the drill?
We're
we can shift into it now.
But yeah, exactly.
Yeah.
So what happens is that the manufacturer or the manufacturer's rep has a legal obligation to maintain it for a period of time. I find that will work better, because if you leave it to anybody else, a workshop or local, it don't get repaired. But we have to take the same approach to the buildings. Every time a pipe leaks, and by the way, it applies to your house, it applies to everywhere. If the pipe start drip, you try and fix that pipe, because eventually some dripping will take place somewhere else. You not only have water bill to deal with, it dripping at the wall. Once a wall becomes wet, it leads to all sorts of corrosion, mold and everything. And I don't think we have done that well enough. So in my sectorial 2 days ago, I asked that we appoint a manager for operating theaters at all hospitals, that they have routine scheduling, routine maintenance. In other words, you don't just use the thing till it broke down.
Yeah.
You shut it down for some time and maintain it in a proper way. So we're going to have to do that more, and that has to be accompanying the build out that we're taking place now, because otherwise it won't last.
Yeah, because you're building all these new things, and then is it going to be the same thing 10 years from now again?
That's the problem. That's the point.
Well, you mentioned earlier about COVID being an issue in regards to the pace of progress in regards to these type of transformational things, but some people feel like said them type of transformation should have happened sooner. So what would you say to the people that have been, or at least expressed some frustration about the pace of progress?
Yeah, the pace of progress is always an issue from the perspective of the user who wants better. And you have to understand why. When you campaign in our democracy, you raise expectations. So that's how you get support. You create hope, and people buy into the hope and support you, and they expect you to deliver after the fact. Sometimes the deliverable is easy because it's some decisions you make, like the 1.5, which the government delivered on, and many people were happy for that. We campaigned on it, we won, and we delivered. Other times, if it's about building out infrastructure, it takes time because of the bureaucracy involved. Let me give you an example of the challenge that I face with this build out of hospitals. I went to Washington 6 months after I became Minister of Health. And negotiated or started a discussion with the IDB to borrow money to support the build out of the Spanish towns and so on. We only broke ground like 8 months ago in the second term. In other words, it went through a process that involved multiple layers of meetings, approval, send back, come back, go there, so cabinet, blah, 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 then procurement. I'll give you another example of how things are frustrating. Even with the 3 years of COVID with Cornwall Regional, I looked at the data. We have about, for the $8 billion spent, there are about 35 contractors that were involved, I'm told. The average period of time it takes to get an approval for a project for a procurement for buying something was between 5 and 8 months.
Wow.
So can you imagine how frustrating it is that you need to move from that phase to get something done, and it have to go through a procurement process that take 5 months?
Yeah.
It's crazy.
Must be.
Crazy.
Must be frustrating to a lot of people. But me have to ask you this as well, because you know, this new healthcare transformation, it sounds promising, but for everyday Jamaicans, especially for those in the rural communities and areas, you know, what concrete changes can they expect to see?
Okay. One of the things I'm hoping for, and I think some people are already seeing it. One, they can identify with their closest health center that will see better service, a better quality health center, meaning you can go there and sit down in comfort. You can use a bathroom and so on. You can see a doctor. We're putting more doctors in our health centers. Some health centers didn't have doctors or don't have doctors. They only have a nurse, especially the deep rural ones. So we're trying also to give make a doctor there 5 days a week, because some health centers have a doctor 2 days a week or 1 day a week. So what we have done is hired more doctors in primary healthcare. So if you can get better service at that level, and I think people will and are in some instances, then I think it will keep the thing in the community. Secondly, the NHF, which has more distribution outlets, we have more drug serve pharmacies around the country. I think we're about 150 or something, right? All hospitals have, a number of health centers have, and some are in private pharmacies. The NHF has written 3 million prescriptions last year. We have added 6 more categories of illness. So, for example, cancers.
Cancer, it was just
in
2.
2015, we only had 2. We have 5 now. So more Jamaicans can expect access to either free medication or subsidized medication. And that's a good thing.
Yeah.
So those are two.
I benefit from the NHF. Yeah.
We all do.
They do.
Right? Because even once you have an NHF card, by the way, which you can get in 15 minutes. Once you qualify, you can go to a pharmacy and get subsidy. Those two, to me, are very tangible benefits that will come certainly at the primary level and from a medication standpoint.
So hold on that. So with these new buildings, you know, being built, where you get the doctor them from when all of them are left for go elsewhere?
That's a good question.
The brain drain is an issue.
Yes.
That's a good question.
Yes.
Very, very good question. Well,
And you say you're not opposed to importing, but then that must be an issue with.
yes. So you know that we have advertised the Barwin Scholarship, which will be published in the paper this week for the second year. Last year, we gave 500 and odd Jamaicans an opportunity to go and study some area of healthcare on the condition that they come back and work in the system for 3 to 5 years. So we have a bonded arrangement for this. This year, we're doing 500 million again. We have special areas that we want to focus on where the scarcity is. So that's a development program. Secondly, we're going to have to improve the retention strategy to get people to want to live here. Building out new facilities is one. Paying people more is another. Giving them housing, especially if they have to work in rural, is a third. And we're doing some of that now. We're going to have to do more of that. And then thirdly, you're right. We're going to have a more liberal approach to others who can come in and work. If we need somebody and we don't have them, and we can get them from Cuba, as we do now, or India, or the Philippines, we can't rule it out, because otherwise the opposite of that is not to have the person, not to have the skill set.
So
Is medical tourism a part of the vision?
Yes.
what do you mean by that, though? Medical tourism?
It means offering health services to non-Jamaicans. People come in for that. People do it now, by the way, but they come from the small islands. They go to UWI, they fly in and they get treated and go back. I love the small islands.
No offense, but
I'm not offended.
why them not come here? No, I'm just saying, like,
Why?
they're coming here. Like most people leave. Most Jamaicans leave Jamaica
but
to
you have
get.
to understand what is in a country that has 50,000 people.
Yeah.
Or
Okay.
30,000 people.
Yeah, which is most.
They would not have some of the services, so they kind of have to. But having said that, we also have some services that are seen as good quality services.
See, me I take Jamaica. You know, I'm
I
sorry.
take it for granted, you know. That's a big diss, by the way, for the health system.
Because he did say small
I'm big diss to the
islands.
minister.
No, I'm just like, you know, many of us Or not even us. Me, Andrews, Yui.
But can I tell you that a lot of people leave Jamaica and go foreign and end up with a Jamaican doctor treat them?
You see?
That's what I say. You're gonna pay less here and get a good Jamaican doctor.
But do you get quality
Absolutely.
healthcare?
I have no hesitancy in saying that Jamaican medical workers, doctors, nurses, and others are some of the best in the
True,
world.
I must say,
The training is quite rigid, yeah. And a lot of them, that's why they leave,
Yeah.
Because they get good offers and they go abroad and they do extremely well. And we end up eventually going abroad. Some people to get treatment from the same Jamaica.
Yeah.
I'm guessing that along with the infrastructure in
The infrastructure is a big part.
Yeah.
It's a big part.
So and I'm sure it's not just in the health sector, but teachers too leaving, police officer, like there are a lot of professionals and there are a lot of civil servants who are leaving Jamaica to go overseas to improve other people's economy.
Well, look at it this way.
are suffering.
More generally, labor has become the most mobile it has ever been. People can move, go anywhere they want to go now because every country have liberal policies. And indeed, many of them invite people to come.
Yeah, except USA.
Countries like Canada, if you have a particular qualification, and they invite you to come. We are not so closed either. A lot of people don't recognize it, but it is a fact that we have probably almost every single nationality here working in some space or the other.
Yeah.
We have Spanish investors, we have French investors, we have, all over. The
Yeah.
Bauxite Company, Russia, whatever. And you see the expatriate community in Jamaica is quite large.
Yeah.
And a lot come and don't want to go back.
True. I see that
That's
Pika.
quality of life.
Yeah, Pika just said like a number of countries who or not lots of residents from different countries get them Jamaican
Jamaica is a
citizenship.
beautiful place,
It is. I just wish it would be better, man.
that's the
Be
thing.
careful of what you don't appreciate.
True.
Because many people come forward and say they're just dead to come back.
That's true. That's true.
Beautiful, but can be better.
I also have to ask you about nurses because a lot of them feel underappreciated or under attack. What are you looking to do on a personal level to make them feel more appreciated and where them feel like they can earn a living here and conditions can be more favorable for them to work in the country where them want to live and
As a
them
son
to
of
burn
a
out,
nurse.
of course. Yeah. So it's personal.
Well, I want to salute you and salute your mother.
Yes.
Because
Who I've been told about several times.
the nurse is probably the most consistent feature of our public health system.
Yeah.
When I visit hospital at 12 o'clock at night or 1 o'clock, and I do sometimes, there's no doctor, there's always a nurse, right? So they run the public health system, and we have a lot of regard for them. We have about 5,500 in the system. We have done a lot in terms of, since this government, the compensation review has in fact increased the compensation package for all categories, and nurses have fared fairly well, I think, and well deserved. We have to do a little more, as I say, on the accommodation side, especially because a lot of them have to work late hours, long hours, in rural parts. As I say, they are the most consistent feature, and so we have to do more around that kind of well-being scenario to make sure that they feel protected. And that's something that we have to work on. There was a tragic incident recently, you saw that, where this nurse was violated in the most atrocious way, which society rightfully decried. So the working conditions is one, which we have to improve on. The recognition for their efforts is another.
Yes.
The compensation, as I've said, we have tried to work on. And really just give them opportunities to keep improving themselves, because job satisfaction is derived not just from pay. People must feel recognized, appreciated in their space.
Somebody bring it up,
Yeah, and that's what we need to do more of that. I've tried to do it. I mean, the government has tried to do it. The Nurses Association of Jamaica and myself have a good relationship and have had over the years.
Yeah, because you're usually the most contentious.
Me?
No, the nurses. I'm from a little penny.
Just to protect myself, I wouldn't say they're contentious.
Okay.
I'll just say they're assertive.
I remember watching news, and they're always protesting. What's her name? I think she died recently, but she was the not recently, but she died. But she was the head Yeah, no, but she was the head of the Nurses Association, and she was always agitating for them.
They are an assertive group,
Yeah.
and they speak their mind, which is fine. They're a large group, and they recognize the importance of their presence. So that's always a leverage for them. And guess what? Everybody leveraged it from their strength. So we just have to make sure them all right. You know?
Yeah. You brought up Cuba earlier, and the U.S. announced that there will be visa restrictions for Central American government officials exploiting Cuban medical professionals. So what's the current status with Cuba?
So we have about just under about 300 Cubans here working in our health system. About a third of them are doctors, the rest are nurses.
And big them up.
Yeah, and they have done a really good job. And without them, we would have a void that we would have to fill otherwise. There are some concerns raised about what the international convention speaks to about human trafficking and so on. And it's some provisions, direct payment, passport issues, and so on. The government of Jamaica have been negotiating a new MOU with the Cuban authorities, and we are seeking to ensure that all of those things are not an issue, because we clearly are interested in the support and working with them, but at the same time we also want to ensure that we conform with some of these international conventions. So it's something that we're working through.
Yeah, you felt bullied by, especially I think it was Marco Rubio that came, and he had a whole press conference, and like literally, I don't want to say threaten, but strong words, and saying that we need to be careful of the Cubans and governments.
I personally didn't, and I don't think the government felt that way.
Like you have to play ball with US especially.
I think we have interests and we have partners. The US is an important partner. Their concerns do matter. And so you dialogue, you listen.
Yeah.
Cuba is an important partner for obvious reasons. So the dialogue takes place at that level too.
Yeah.
And not all the dialogue can take place in front of a
Publicly,
mic. You do what you have to do.
How affected were we by USAID pulling out? Because, with Elon Musk and his Doge, USAID suspended several activities across the world. So were we affected in that way?
Yeah, we would have been, we are, in the sense that there was some support. We had support from the USAID in a number of ways, and the NGO community also had support, especially in the fight against HIV.
Yeah.
So really it's assessing the extent of the fallout, and if necessary, the government of Jamaica has to fill the gap.
Yeah, right.
So that's as simple as that. I mean, we can't force people to give.
Yeah, but we're not reeling. I thought that we're severely affected.
No. We're not going to. We're not going to roll over and die because I mean, it's nice to have the collaboration.
Yeah.
But if we have to go it on our own, then we have to do that.
But when Minister,
we are less affected than the NGOs. The NGOs are more affected.
Oh, okay.
Hold on. Because remember, I said me a son of a nurse, and I know only part nurse and doctor. So I feel like
They're depending on you.
I feel like I need to return back to this topic because beyond public condemnation of violence against nurses, is there consideration for broader policy to address seemingly increasing incidents of violence against medical personnel?
Well, we have made it very clear that our nurses, our medical personnel generally, are there to protect the society and to give service to them. To the extent that they are exploited or indeed abused, we ask for the full extent of the law to deal with them. I mean, I don't know if there is any new policy that is being contemplated, but the laws as they now stand, and we are not afraid to prosecute people. I mean, we have had cases, for example, at Bustamante, I think may have been the most recent, where an irate patient literally broke a glass window because they felt they weren't getting through and damaged health personnel. I'm not sure if it was a nurse or it was a customer service rep. And the law has to take its course because you can't afford for these frontline workers who are essential to life feeling threatened. Otherwise, who is going to be there for us when we need them? So we take it very seriously, and we do pursue cases where we need to pursue them.
Do you factor in like the emotions of the parent who's waiting long, and it's usually people who feel like they feel dissatisfaction in the service. Like, is that even a
What we say
consideration?
is that there is no excuse.
Okay.
No excuse
Absolutely.
for abuse
Absolutely.
or that level of aggression. We understand fatigue, we understand distress, but if you're going to display it in that way, it's totally counterproductive.
So I guess
so we don't entertain that at all.
In that way, with nurse satisfaction, in improving that the service, like in ensuring that there are more people, like getting the process done more efficiently and effectively.
So we do that, which is why we have the customer service rep, which is why we have added digitization to patient registration and so on. But we also ensure that we have security in the institutions.
Right.
So all hospitals, the security bill is like astronomical.
Why not JCF though, where you can probably arrest them and prosecute?
No. Well,
them?
JCF will come behind and do what they need to do, and if we need them, we call them. But it's unless there are one or two institutions where we have a JCF post, like down at KPH. But generally speaking, they're private security.
Okay.
If money and politics weren't a constraint, what's one health innovation or initiative you'd have implemented in Jamaica immediately? You never have to deal with them things, because I know it is things that you have to deal with.
You know, I tell you something. I have a perspective on health that is very lifestyle focused. One of my most treasured books is a book called Blue Zone, which really looks at areas in the world where people have lived the longest per capita, centurions, and looked at the lifestyle and determined from that what are some of the common variables. And health is really lifestyle, really about lifestyle. So you ask the question, if I could put a park in every town, a green space, where people can go walk, them can meditate. If I could...
Several wellness benches.
Well, yeah, fine. If I could put walking trails, jogging trails, bicycle lanes, where people can go ride, hiking, that kind of thing. Because when you really think about it, life, we've really got, and all of us have gotten a little twisted in terms of what are our priorities. Some of it is external influence. You think people brag about working 18 hours a day.
Not me.
But after a while, them dead. Because stress kill them.
Yeah.
You know what I'm saying?
Balances.
So my view on life is that while we mustn't be lazy, and we must always have ambition, and we send my children to school and insist that them learn some life skills, swimming and music and all that sort of stuff, because I see a kind of holistic approach to life. And I think one of the things that developing countries are missing is how we plan and lay out the infrastructure for lifestyle that is more, it creates more wellness in the society. Because I think that is the biggest contributor to long life and quality of life. So if I had money, I would do that. We would have to go transform and reformulate Kingston. So for example, I'd love to see a bicycle lane out at the airport stretch. You should have when they wrote a bill.
That's the perfect
Yeah,
spot.
because a lot of
Understand?
people do walk and
Oh, yeah, a lot of people. I've gone out there and run, but
Less people would be hit
I
down
worry
by
about the
cars,
bicycle
too.
man, them a ride on the main road and the car them a come
Yeah,
150 miles an hour. It's a tough one, right?
Yeah.
And then you create these things and we have to question safety, like at the parks and stuff like that.
Mandela Park, for example, is heavily used. That's the NHT development. The Prime Minister has been pushing.
Downtown, right?
No, the one in New Kingston.
Emancipation.
Emancipation. Sorry, Emancipation.
That you too.
The Prime Minister is also, I think, has that vision, because they're going to be putting a park in Portmore. They're looking at some other places. I think that Jamaica needs this sort of softer infrastructures that promotes lifestyle and a particular type of lifestyle. And from that, you can now tag onto that nutrition and Jamaica is blessed in many ways. Listen, I have a constituency, West Central St. Catherine. Big up to them. The best constituency in Jamaica. And them all going to vote for me. Next election. I'm putting the plug. Oh, that's all, right?
In the work.
But let me tell you something. I go to my constituency. at least 1 day a week, ideally 3 times, right? There is no fruit tree that is missing up there. And it's almost taken for granted.
Yeah.
When you go, the higher you go up in the hills, because I have a little urban area out of near Spanish Town, Fraser's content. Once I go up John's Road, go through Kitson Town and go beyond Kitson Town, it's just green.
You must happy now, though, because you getting beer mango now.
Let me tell you something. Last night I came home with a box of ripe banana. And the banana them big so ripe. Right? And I love jackfruit.
Yeah.
Jackfruit tree for stone dog, as them would say.
Yeah.
Wow.
Mango tree, this, that. And I said to myself, which country you can go and get that kind of abundance?
Yeah, and the constituents, like your constituents, that's what they can provide or offer you, or, you know?
Well, I tell you, it's just there, you know. But it's in other words, and the point I'm making is that nutrition is a matter of choice. It's not so much the absence of the options. Certainly from a fruits and vegetables and grown provision perspective.
Yeah.
And what I think we have to get people out of is the processed food, because that's the biggest cancer causing. I rather eat a piece of yam and a piece of sweet potato or 2-finger banana with my food, far more than taking some tin food from foreign where must make about 1 year ago have some chemical in it to preserve it.
It can't expire.
Exactly. That's the point. That's the point.
Well, I mean, it's all I dead one.
That is true. That is true. But we need to get to a certain,
Other people are going to say, we're going to
YOLO. No, but Minister, we have to talk about the $31 million
Yeah,
trade.
let's get into the scandals.
Yeah.
the scandals.
Scandals,
All right.
because
Wrong context.
because Dr. Dawes, he's the opposition spokesperson on health.
Alfred Dawes.
What was that?
No, Dr. Dawes.
Dr. Alfred Dawes, right? He was saying, the one drill, and you could get it for $4 to $5 million, $3 to $5 million for the one drill. So really and truly, doctor, like, maybe you can speak on it. You should be able to speak on it. Why was the procurement for one drill cost $31 million? And I know it was broken down in the Gleaner, where they talk about the total cost covers $27 million for the equipment, for context. It's priced at $3.9 million, and the electric console invoiced at $4.2 million, and 2-year preventative maintenance package is valued at $4.2 million, and it brings the total just to over $31.4 million. And that was dated November 19, 2024. But you have to kind of understand that the nation's concern. It's like for one drill.
First of all,
$31
everything is context, and the opposition spokesperson has been quite dramatic, as he normally is, to create a scandal in every circumstance. Unfortunately, he has not created one ounce of evidence to support his claims. He first of all, he quoted several figures. He said the drill cost $250,000. Then I hear some about $1,600. Then I hear $4 million. Then $5 million.
Yeah.
I have to provide leadership. I can't be all over the place like that, right? Second of all, there's an unfortunate analogy or being drawn between what a drill is. We're not a Google government. We don't go on Google and run country. We have to go by the science and what the facts say. You can't go on Google. I can go on Google and find you a car for $300 and find you a car for $1 million. Okay? And indeed, you can buy one from a car lot at different prices. So a drill is not a drill. Okay?
Wait,
not to
what?
mention the fact that
A drill is a drill.
I am being brutally honest.
Yeah.
Okay? So that everybody understand. I can go to the hardware store because some people hear drill and somehow think it's something that they use similar to drill.
Yeah.
Drill. And even those drills have various prices. So this drill argument is nothing more up to this point, unless there is evidence to support otherwise, than an attempt at exploiting people's understanding about what their traditional interpretation of a drill is.
Okay.
Without any bearing on the science of brain surgery, the science of spinal surgery, what doctors require, neurosurgeons, to do the work, and the complications around accuracy, complications about ensuring that things work, and all the other parts. And so until there's evidence to support otherwise, there's only one thing as minister that I care about. which is that the process of procurement was followed.
Yeah.
Because that's my job. First, I don't know nothing about drill, by the way. I'm not a neuroscientist, and I was never involved in the procurement process. It was handled by the regional authority, which is Sarah. How the process works is that you want a product. There is a terms of reference, a term sheet written up. This is what you want. This is what it must do. The people who are in the field are a big part of preparing that. So neurosurgeons, 2 neurosurgeons among with others, they said these are the specs of what we want. They want a neurosurgical drill, not a drill at Hardware and Lumbar National Supply. And not a drill you can just go up on Google and see or reference. They point out what they want. They point out what it should do. Because that's the other thing. A drill can do several things. So you have parts, you have attachments.
Yeah.
My understanding is that this requirement was for about 100 attachments to the actual machine. And then thirdly, the extended service. So all of that was written up. It was advertised. Companies bid. In other words, how the bidding process is what determines price, That's why people bid. And that's why the procurement rules say you must bid. So this argument about high price versus low price. Tendering and bidding should take care of price, because if a man want the work, he can give the most competitive price. If he don't want it, he won't get it. If he doesn't, he's going to be kicked out. But the price must also equate to what is required, because somebody can underbid, but they're not providing what is required, and they'll kick them out. The system, that's how the system works. So you have 3 companies who saw the public ad. Companies have to be registered, which is the other ridiculous argument that they make. Why we never look for the drill and find a company that could supply the drill. I couldn't do that. The regions couldn't do that, because you have to be registered with PPC, Public Procurement Committee, legally to bid on contracts. So if you found a company in Timbuktu that could provide a cheaper drill and they're not registered with PPC, they wouldn't qualify. So you don't even bother think about that. That's a non-argument. They bid, the evaluation committee evaluates. 1 was kicked out, 2 were left. 1 fit most appropriately met the criteria. 1 was actually, I'm told, 50 million, 1 30 million. So 1 was actually higher. It was evaluated. Then it went to PPC, which is an independent body. Now they review the process again under law. Them have nothing to do with CR or anything. Them take everything and review it, and them say, okay, approve. Now, who am I now to go argue and say that the drill is a wrong drill or a bad price drill? That's not my thing. Now, if the opposition has evidence otherwise, which they have failed to bring up, then they should bring it up, rather than running around like a drama queen, jumping over walls and using all sorts of stuff to create an impression somehow that people are abusing the system. And worse though, and this is to my mind quite reckless and irresponsible, maligning people's reputation.
Because
what you're doing
medical
is
technology.
you're accusing a company that has been around from, I'm told, 20 years, 20 plus years. You call in people's names. Now, when you are so bold to do those things, you must have evidence. Hence the court cases that are following, which is why I kind of stay behind and just leave it, because if out of all of this, there's evidence that something untoward has happened, then as minister, I have a duty to step in and say, okay, let's look at what the policy is and what needs to be changed. I have no issues with that, because there are imperfections in the system. I have no doubt about that. No system is perfect. But you can't be making these wild accusations, hyping it up on social media, running around and playing, to give for likes, put it that way. While doing that, damaging people's reputation, and call that leadership. That's not leadership, not to my mind anyway.
But the thing is too, is like because it's Sarah, so Sarah, the regional authority, it's 1 drill too. So would that service the entire region? And what about the other regions who would probably want a drill?
So like you and so many others, having looked at all the controversy about this drill issue, I went to Buster to look at some other stuff. And I said to the CEO, I want to see this drill, because this drill sound like it's famous. It's more famous than me. Right? So
That's crazy.
It's a must-see.
I said, if this drill run for election, they probably win.
That is
right.
crazy.
Anyway, so I asked them to give me a sighting of the drill. First time I seen this drill. 2 neurosurgeons came to the sighting to do the demonstration, to tell me. So when they went through, firstly, what they used to use, which is a handheld thing that would screw into the skull, right? Versus what the drill that they have now does.
She's like,
They say, Minister, we have
thing.
moved from the ancient days to modern times. That's one. But secondly, and more importantly, they have said to me that this piece of device will contribute to probably half the surgeries that Buster does. And I asked him how many surgeries Buster do a year. 2,500. It not only is a brain drill, it does about 5 other procedures in the operating theater. So what apparently has happened is that they did a terms of reference for a product that would solve multiple problems.
Yes.
Surgical problems, and would contribute to saving a number of lives. Who am I to argue with that? How do me as minister now tell them, say, that them should have did buy the drill we only do one thing? If they say they can get a drill we do 5 different things.
Or buy 2 more anchors.
or whatever. I can't argue with that.
Yeah.
So, guess what? It's part of the...
But you are
The
not
silly season,
concerned
put it that
about the
way.
cost too, and the fact that it's just one drill, like how would
I'm not
can it
concerned
be
about
shared?
I'm not concerned about the cost, having understood the context. I'm not concerned about the cost, having satisfied myself that the procurement rules were followed. They were not breached, they were followed. Again, unless there is evidence to suggest otherwise. And to date, outside of the gimmickry around it, I have seen none to suggest otherwise. And I am not going to bog myself down with going behind curtains, go ask or look or check people's record at the company's office. And that's not my job. That's not my job. I have too much things to do. The procurement process was followed. If there's and there are agencies to do that, by the way. There's the Integrity Commission. There's if they in their wisdom think that it requires
Not there for
if they're in there with something it requires probing, then they'll probe it.
Sir has since affirmed that there has been integrity in it.
Yeah, that's fine. That's fine. And if they come back with something that requires assessment and change, that's a different thing. But up to this point, I haven't seen anything.
If I ask you on a personal level, does it irk you to see when health and wellness issues are politicized? Yes, because we're talking about life and death in certain cases.
Yeah, it depends on how you interpret politics.
You're a politician.
Yeah, exactly.
And I'm sure you've probably been accused of
I'm a
such.
politician, so I can't say politics has to be involved, but it must be the politics of ideas, right? So I went to the parliament on Tuesday, and yes, I challenged the opposition on a couple of things that they have said, and countered with what I consider to be the facts to suggest otherwise. But beyond that, I put policy proposals on the table. I would have hoped that what we need to do going into this election is discuss the policy options to enhance public health. So if the opposition thinks, for example, that we are not doing primary healthcare reform properly, and they think we need to do X, Y, Z. So I raised the issue, for example, of the older population and the fact that our population is aging, and what is the future of healthcare to deal with older people in the society who want better care and care at home, care in their communities. That's a very serious policy discussion, because believe it or not, all of us are going to get there, me before you, but you get there too. And the next 15, 20, 25 years is a very defining time for us in terms of our demographic transition, where you're going to have more older people, and they're going to have the diabetes, the arthritis, the whatever. They're going to want visitation at home. And that's why the AI technology thing that I spoke about is so important. Those to me are serious conversation. Now, I understand we have to jive at each other now and then. So Dr. Dawes have to do it to me. I'll have to do it to him. And you have to enjoy it while you do it. But don't get carried away to the point where all you do is just keep it at a level that is so base that the people are not better off, because we're leaders and we people take cue from us. And that's my only disappointment sometimes.
So you just talk about like our declining population, and of course we've been talking about it, or we're skirting around the topic throughout the interview. But the real question that I'm asking is like, why should we care? Like, we are.
Why should you care?
Yeah, because to me,
This person like you not go have no babies. How many you have?
None.
You don't know how hilarious that statement is to her.
Yeah.
Really?
No, because
okay.
because I'm just thinking, like, remember high school, like overpopulation, underpopulation, the right population, and it's
Family
like
planning.
and family planning, and it is like the resources that outmatch or that's not matching with the population that makes us an overpopulated nation. And I'm like, if it's declining, isn't that good that we can the resources can then match the population that we have, and that can help us
It
be
depends.
a
It
good.
depends. But let me say a few things, right? And hopefully I'll convince you.
Get them eggs ready.
That's
girl.
funny. That's hilarious. Okay, Mr. Communicator. Okay, Mr. Marketer, go.
So, population really has to be placed in a particular context when you discover resources. There was a time where we thought we were growing too fast, and that was the concept of two is better than too many.
Yeah.
There was that is seen as probably one of the most successful campaigns in Jamaica. And in fact, I compare Jamaica moves with that. And I know that sounds like a self-serving, but Jamaica moves at least reached a lot of people, and the Caribbean has adopted it and so on. So we're proud of it. But two is better than too many as a campaign. All of you are too young to remember it, but Google it.
No, my mother tell me about it. My mother literally have two picnics because of that.
Effective.
Yeah.
They reach people.
Yeah.
Two better than too many. You must can't mind the picnic what you have.
Yeah.
And
That
don't
was my
have 10. No, when it don't apply to you, no. It's 5 you need to go to, right? Anyway, I'm giving you guys trouble. But
Problems.
so but what has happened subsequent, and it's a global phenomenon. It's in fact, I tell you, in Japan,
I know, I was just about to
in
mention.
Russia, them say they cut off the light at 10 o'clock to encourage child rearing. Yes, the late line I saw last week.
Wow.
Mad thing.
Right?
That's too much, Russia.
No, it's true.
Mad.
So what is happening is that if you can replace your population and you need a birth rate of about 2.2 per something. I don't know if it's per capita or per 100,000. I don't remember right now. And you're about 1.9. So basically you're having less children. And when you factor death, migration, your population is like this. So it went like this, then it taper off like this, and it's threatening now to go down like this. Wow. So you actually could be in decline, right? What that means, you say about resources, is that, remember now, your biggest resource in any country is the people,
Yeah.
So no matter what you have, if you don't have the people to create the productivity levels, to transfer or develop
See,
things.
it's all about capitalism. It goes back to
no,
capitalism.
not capitalism. It's about capital.
Capitalism.
Human capital
Yeah.
is the most important criteria for development.
Yeah.
So, like, we're facing a job crisis. I mean, a skill crisis.
No, but
so
not
if
for
you
the people
can't
that
grow,
don't
you
have
can't build another
TikTok.
hotel. Hold on, just a case in point. It's hard to build another hotel if you don't have the people to work in the hotel.
Yeah, but the
You get the
thing
point?
is,
The
there,
point
we
I
have
raised
enough
earlier.
people. We have enough people now, but them decide to go on TikTok and have tops and roses. Good strapping young men now work no more, and them a scam and them do all them something. They focus on them, tell them to go and not scam, man.
Well, we have to do that.
stuff.
We have to do that too, but I don't know if that would address the replacement value. So what really needs to happen, but you have to manage it, is that ideally you do want people who can afford to have more. We haven't started that campaign. This is not an official notice, right? Just to be clear out there.
Yeah.
No, this is the Labour Party. I say you must go. They go. Them already have me off as the man to promote having children. Because I've said it, but it will pose a socioeconomic challenge in the future.
True.
But my other issue is with that too is, again, okay, so capital, but then what are other policy that the government, education, crime, leave, like healthcare,
Yeah.
like not even.
Well, remember,
what do you call it?
Paternity.
No, not paternity. What you look out for the picnic them when the people that your mother have to go work?
Oh, you mean daycare?
Daycare.
Oh,
Right.
I was like, what?
Because
But
you
we
know-
do that now. If you go to a lot of our hospitals, we have nurseries there that workers can leave their children, carry their
Well,
children.
the nurses.
No. Nurseries where we tend to the
Oh,
children.
so like if I have a kid.
So if you have a child and you go work at UWI,
yeah.
and your child come from school.
No, I'm not working at you. I'm working here.
Oh, well, you're
See?
coming here, I forgot to put one here.
See, exactly. So there is
Only
like
certain people have privilege.
Yeah, and I'm
Companies do it.
that-
Some
and I'm
companies
thinking
do it.
like that, like, you know, like even just like the economy, like how is it gonna fare? Like, can I?
Well, there are many programs that governments over the world introduce to
Yeah.
incentivize children. Some
Yeah.
people even pay people after they have
I
their
know.
children, give them longer leave. I think in England you can take up to nearly a year.
Yeah, I know.
Men get leave as we have introduced recently.
Yeah.
So it's not just the women. And you could go on and on. So
Yeah, I'm just saying, like, is there what are you were concerned about the declining rate, but like really support, like pre-natal support and postnatal support, and not just in the health sector, but socially, because you know many people have moved from them homes, like they don't necessarily have their parents there to help and support them. We don't have that communal feel where the village is looking after
Yeah,
the
unfortunately.
There's
children.
no longer a
Because
village.
of that,
Yeah.
people saying us
Yeah.
focusing on, you know, increasing birth rates are overlook like deeper societal
Yeah,
and
issues,
economic issues.
yeah.
No, I agree.
Yeah.
And the truth is that where we're having more children are in areas where socioeconomically there's a lot of deprivation, unfortunately. So you really want people who can afford to have them
Yeah.
them, but people who can afford to have them are not having them.
Yeah, because
are they
you're
having them
cutting-
later in life?
You're
huh?
putting into my disposable income. I want to travel the world.
But you can
Dr.
travel the
Tufton.
world. There's no
No, I have to
restriction.
focus on my kid.
Carry
I can't
him,
be
carry him or
selfish.
her, or carry them.
I don't want to do that.
That's very possible. You don't need to. You know. But it's a challenge you have to confront, and government will have to come to terms with it.
Yeah.
True, because well, like when you talk to women, you know, they feel unheard, they feel unseen, they feel unsupported. So it's like
Yeah.
them a priest say, "Oh, you are telling me this, and me not feel safe in my own country."
Yeah, yeah.
You
Yeah,
think
okay.
I should, as the woman, say that and not you as the man?
No, but I say like from the woman's perspective,
Yeah.
from talking to them, and whole heap of women they feel this way. Say we don't feel supported. So
But you
Oh,
do
yeah,
agree that the crime rate is coming down, and so the government is definitely making a good effort to date. We have to continue, but it has come down, 40% year over year. And the government has invested a lot in that. So I think there's some success there. But I do agree that whatever is motivating women and men, because it takes two to tango, not to, or to delay, or to just say no, it may need a conversation. And some of these
Yep.
things we have to be open about it.
Yeah.
Yes.
I announced in the sectorial on Tuesday about the women's health and perimenopause and menopausal.
Yeah. Women dying in childbirth.
Yes,
Jody
yes,
and
and then to
Farron,
maternal deaths and that are coming down, and some of the things we're about to do. But in the past, people never talk about people going into menopause.
Yeah.
Women going into menopause.
Yeah.
It's almost taboo, and women suffer in silence because there are a lot of women who experience significant trauma in that period of their lives.
Yeah.
And by the way, men have similar hormonal challenges.
They do.
Yes, obviously not exact same as women, but they do. They have emotional changes, mood swings,
You
that
guys
sort
have
of thing.
emotions? I did not know that.
I tell you,
June is mental.
I have a lot of emotions. I can tell you that, right? I hide them, but I do have them.
as us men tend to do.
Yes.
That's the problem. Yeah.
So it's a challenge. We have to look at a more holistic approach to healthcare, which is what I'm hoping will be a part of my legacy.
Yeah.
True, because enough of the woman them says like it's almost like blame we for a bigger societal problem. Like society need to fix before.
The
Yeah.
economy,
I
because
know.
usually, as you said, two is better than too many. That's always been the problem. It's like having too much kids or having any
Too
kid
many,
at
yeah.
all. It drains the economy, and everybody wants to have a good quality of life
It
where they
doesn't-
can enjoy
I
themselves.
don't know if it
and
drained
life.
the economy. It's a
No.
It's a responsibility that you have, yes, as a parent, and it is a fact that oftentimes
Kids are expensive.
no, but the woman is the parent
Yes.
because the men abandon them responsibility, and that's a
Yeah.
bad thing. I'm a single parent child.
Oh yeah.
My father never had anything to do with my upbringing,
Wow.
but that accounts for quite a few Jamaicans.
Yeah.
Hey,
And
Dr. Tufton, you say, we pause this up.
Yeah.
Sure things are breaking news that today I say, I'm a single parent.
child.
No, you did pause. I was like, oh.
Well, I said, no people say, see that we catch him now.
Get this.
No.
The family's broken up.
My father never take care of me at all.
Oh no.
Well, you know, I have no regrets because back to what you said about being grown by a village. I mean, I had an amazing mother, strong, and she was my mother and father almost, right? But I also had aunts and uncles, and I had family. I grew up in the best parish, Manchester.
Okay.
Right? I don't know.
Portland.
Portland. Yeah, that's a bad one. Yeah. Number 2. I don't know where the other.
I like a beautiful women in Manchester.
Yeah, man. Manchester is a good place.
But then you see, the pressure was on mommy, and a lot of
pressure was on my mother. Yeah. But by the village concept, and I'll be to my not this book, but the state of mind, my first book, how I grew up, and it looking back, I have no regrets because the village kind of take care of you. Now, in this modern time, if you look upon somebody else picking too hard, you're likely to be charged with abuse.
Exactly. I see a kid running in the road. I'm like, you know what?
Which is sad. Which is very,
that
very
sense
sad.
of the community, child rearing, kids like it gone.
People are a lot more skeptic too because it's like you don't know who to trust.
True.
That's true too. So we have to bring back those traditional values, some of them. Some of them may be lost, I don't know, but the concept of community, which is why I love primary health care.
Yeah.
Because we have a program called Adopt a Clinic where we get people to adopt a health center. Invariably, it's people out of the diaspora who come from that community and decide to adopt that clinic. Because them say, boy, you know, I did book me to this, so I did go and get it dressed. We fall out of apple tree and them remember that sense of community.
Yeah.
And if we can get people to evolve or revolve around this health center and this community concept, it's a nice feeling.
Yeah.
Nice
And
feeling.
even to add to the part about support, because a lot of women were complaining about the postpartum depression, like that period where you are with the newborn baby and the father pretty much can't help because you're the one getting up, breastfeeding, doing all the work. So we go through the motions, but we didn't really know that it was actually depression. And I don't think it's a part of the postnatal care because it's most of the attention is on, you know, the care of the baby, the newborn baby. Yes, the mothers get care too, but mentally,
Absolutely.
we don't focus on that.
The health system is trained for that, but to the regular onlooker, they don't understand it. So part of that is that when you counsel from the health system, the mother, the father should really be a part of that, or some other responsible family member, so they can see your perspective as explained by the professional. So ideally, that's the right approach. That's why we have people who visit. We have community health aides. We have the public health nurses. They actually go to the homes. I've done it with them. I walk with them and go in a people's home and you check with the lady with the baby who is 5 months old, talk to them, hear from them, that kind of thing.
So is only certain people get that?
No. Anybody who wants it can get it. It's normally... So what we have done is added a lot of community health aides to the system. We hired about 1,000. We have about 2,000 now in the country. So they are responsible for, under the supervision of the public health nurse, they go out. As a matter of fact, they go out sometimes and wash up dishes for the old people's home. They comb them here, them sweep out them. They literally do everything. So they almost integrate themselves into their space, check their medication to make sure they're taking it. And
see, that's what I'm
that
talking
provides
about.
a lot of value to people.
Every time.
That's what I'm talking about. Because listen, Dr. Tufton, if you guys have a panel and you know you need some, what do you call it now, like research focus group, please include me. I have a lot to say about this topic, about the birth rate. Okay, I think there's
hold on a little bit.
There's
we kind of
really...
we don't like if you have more experience in that.
You know what? Let me say this. Let me put this on
to become a full
Just stop
certified expert. No.
Hey,
I would never say that.
Them ever style we, you know. So yeah. As girl did that them thing.
No, but I said I'd have one. So if people want to have one,
we're making good progress. You're going from none to one.
Right.
If I spend another hour on the program, maybe you might get up to about 2 or 3.
Yeah, but if it is one, can we have one?
Absolutely.
One is enough to help.
One will definitely bring the average up. I've always felt. I've always felt that, maybe two might be not such a bad thing,
See them at tell Jeff go have 5. 3 good enough.
But even something else that's would be seen as scary or a scare. In 2022, 13 babies died at Victoria Jubilee Hospital. Since then, what preventative measures have been put in place to avoid?
So what happened there was that we had a situation of, I'm not sure if it's 13 or 9. Anyway, whatever it is, it's bad.
Yeah.
The issue was more around infection prevention and control. So there was a vulnerability on one all babies were vulnerable because it was a vulnerable sensitive unit that they were in. So these are born premature, they have challenges and they're placed this year for special care. And what seemed to have happened was that there was cross-contamination. So because of how they were handled, largely because of the ratios of nurses to baby, largely because of the shortage of those kind of nurses. So ideally, in a situation like that, you should have a 1-to-1 or 1-to-2 ratio. So 1 nurse to 2 vulnerable babies. And sometimes we get up to 1-to-8 because we don't have the nurses, right? So because the nurse is moving from one to the next, to the next, to the next, to the next, normally they should take off the garb, wash the hand, sanitize properly. But because of the need to constantly monitor, sometimes there is cross-contamination that you can't see with the plain eye, but it affects. And there may be other reasons too, but that contributes, I think, in that case, based on the reports that I've seen. But we have tried to correct that by putting in some new rules around infection prevention and control, things that you must do, and insist on it, more training. And the ideal scenario is to add more people. And we have done some of that. But of course, that is subject to the availability of the people. So you try to learn from every situation, and that's what we do: review and come up with some solutions.
Yeah.
Well, does the weight of the scope of the job you ever feel the weight type more than?
Like when deaths?
What?
Yeah,
man. Of course. In the book. Sorry, I have to put a little plug.
Plug.
The book is a legacy piece for me, and an obligation I felt because I kept a diary and wrote as I went along what was happening in COVID, and then transcribed it with some editorial support, and it's real life. So I spoke to the case in one chapter of Jody and Ferran.
Yeah.
And I indicated that was the time that I actually shed a tear, literally. And I tend to hide my emotions fairly well, right? Which is not a good thing, but I try to. And do. Because Jodian really never had to die and should not have died. It's a case of a young lady who was pregnant, who paid to get a service at a private institution, but private institution had a policy that says if you have COVID, you can't. They don't treat COVID cases.
Right.
She displayed symptoms of COVID, and therefore could not be delivered at the institution. So she was transferred to Spanish Town, then to UA. And then all of that up and down, the baby was born, but she passed. Now, subsequent reports which were made public, so I can comment, they might show that she had some complications otherwise. But the truth is that if she was properly lodged from the early onset, the chances of her passing would have been far less. So when I got the full report of it and thing, it was really... I know it was in a period when everybody was stressed out, me too. But just to hear how the thing evolved really was sad. So,
even with the hospital who first denied her, like, can there be any sort of punitive measures or actions put towards them for lack of care?
Yeah, man, of course. I mean, there's a complaint system that could go all the way up to the courts and claims made. And it has been done and is being done. I mean,
and not just from like the family, but just like even from a ministry perspective, governmental, like, can you like charge them or I mean,
not the government,
Yeah.
but the complainant, the aggrieved party, normally the family, can take the strongest possible action against the government, against the institution. This case was a private institution, but depending on, they could also bring the government into that, and people do it.
Yeah.
And you know, that part of the system is necessary too,
Yeah.
because it ensures checks and balances and
Yeah.
ensures that you stay on your P's and Q's. So,
Yeah.
man, that happens all the time.
Another reason why we're afraid to have kids.
Why?
The maternal death rate.
Well, yeah, but hello, you could go outside in a car, God forbid.
Well,
We don't know.
at least I'm me one dead.
No, sir. What kind of response that?
This is a morbid one. I'm telling you, a dark one.
Oh gosh.
You did hear about the incident with Chronic Law manager with his daughter?
Yes, of course, I did. I did, and I was the victim of many criticisms over it. Again, another case of leadership bearing the brunt of the burden.
Yeah, because he accused like the doctors involved of negligence.
I wasn't involved in the process, but heard of it and tried to resolve it from the perspective of the responding and trying to encourage a meeting of the minds after getting the report. Well, not me, but the office of the CMO on what transpired. Then there was a second opinion which said something else.
Yeah.
And the family eventually met with a team. I was at the time there or in the vicinity, had a little discussion with them. And then from there, everybody just got toxic and said, you know, we are to be blamed. And
Wow.
I was cussed out a whole heap.
Oh no.
But, you know, again, I can understand the emotions. You know, people is a personal thing and it affects people's emotions. Even though I did try to get both the technical explanation as well as the counseling that we normally do when cases like this happen. You know, so we regret when these things happen. And they will happen, unfortunately, from time to time. And yes, I was involved somewhat in terms of trying to address them. So I get involved when all the other, it kind of ratchet up
Okay.
from institution to
You're like the
region.
last resort.
Yeah, it eventually
yeah.
comes up to me. And if I think it's a national issue that is, you know, being put out there and, you know, addressing, you know, the concerns I raise, and I get involved.
You think you have done a good job? Like personally, would you rate yourself?
That's not for me to say.
Yeah.
I don't think it would be appropriate for me to judge myself. I think people have to do that. And
All right, separate and apart.
might
Like
not
you
be.
think the government, because it's political time now. I mean,
okay, well, if you say the government,
Yeah.
then that's a different story.
yeah.
I think the government has done a very good job in, firstly, if you're talking about health, paying more attention to health than any other in a long time. And it's reflected in the budget. I mean, when I took over, we had a budget of 60 billion for health. Last budget was 160 billion. We had capital budget in 2015 of less than 2 billion Jamaican dollars. This year's capital budget is almost 11 billion. We had less staff. We have about 3,000 maybe more posts now for staff, doctors, nurses, and so on. We're offering more medication, more services at the community level. So, to my mind, the government has done a very good job in giving support in terms of resources. What we have to do now and do a better job at is how we combine the resources to manage the process and deliver optimally to the patients. So things like the customer service that you talk about, you know, things like the maintenance of the equipment that you're buying and the hospital. I don't think we're there yet. I really don't think we're there yet, because it's a culture, and culture don't change overnight.
True.
You have to get people to
Bye.
adjust their mindset and say we all do things differently. We don't do it that way again, that kind of thing. Also, there's a lot of unfinished work which the government won't get credit for now, but will eventually. So when Cornwall and Western Child is open in Mobe, you're gonna have 800 and odd beds. You're gonna have 11 plus 15 operating theaters. You're gonna have more specialization. You're gonna have much bigger A&E, more equipment. When that place
More
is open,
staff?
much more staff.
Okay.
When that place is open, it's going to be a beauty to behold.
I just want to see more development in our rural areas because I've heard many stories of people seeking care and
they live so far.
infrastructure not good at this place and then they have to go travel go out of town and by the time they travel go out of town, people pass away. And
Yeah.
if the issue could have been dealt with sooner, lives
level.
could have been saved.
So
Many a
yeah,
time,
so we're doing that with places like Maypen Hospital and you know, St. Anne's Bay and so on. The way the system works is that you can't offer all services in every location because you don't have the people to man the stations. So it's a hub and spoke. So you recommend and refer. But what you must have is a sufficient capacity in each location to see people, assess their challenges, stabilize them, and then let them go somewhere else to get the specialized treatment. And that's how most systems work. So what we have to do is build out the rural areas, which we are doing in many ways. Chapelton Hospital, for example, was shut down until the government took over.
I remember.
We now have about 40 beds, they have an operating theatre. We just need a few more nurses to do a full 24-hour thing. That's up in Northern Clarendon.
Yeah, I know.
And then that's where you're from?
No. Holy power.
Okay.
Special government agent.
Special government agent, right?
Shut up. Big up Nesta.
And then, yeah, he's very happy for that. And then Lionel Town has been improved. We moved from about 6 doctors to about 21. So we're doing it. But, you know, it takes time.
True.
It take
And
time.
I mean, are we in election season now? Like, can you share if is
Can
this
I insight?
campaigning? What's happening?
Well, look at it this way.
Then the
Constitutionally, election is due by September 12th.
Yeah.
Unless there is some act of disaster, you get another 3 months. So for all intents and purposes, you have to be in an election period.
Yeah.
Yeah, about 3 months or so.
Yeah.
It's not a long time
No.
for a 5-year cycle.
So can we expect it to be called soon? Because I know I see.
Prime Minister have the handle on that, and I wouldn't try to second guess him. But if it is 3 months constitutionally, then one could argue soon because 3 months is 3 months. You have 21 days between minimum.
Yeah.
You could call it 21 days before the date.
Yeah.
So he could actually call it in August and
is-
have it in September. That's
Yeah.
the outside possibility. But otherwise, he could call it anytime.
Dr.
And
Tufton, stop beating around the bush. When the election occurred, when have you heard talks are being had? When it occurred?
Can we get an exclusive?
Can you imagine me come on the fix and
Breaking
be
news.
so presumptuous
Oh,
to
God.
second guess the other
So
prime minister
the
and call election?
Bro gotta call Wicked Man
That's
Chris.
the day when the health portfolio would be taken away from me.
But as a MP though, because you wear many hats, like you know your
No, we all preparing.
husband,
Yeah.
Minister of Health, MP as well. Like how are you faring? Like you think you as a
Man,
minister
I do
is it
my work.
lacking?
I do my work, man.
Are you
I've
fearing-
learned my lesson from St. Elizabeth Southwest.
Yes.
So I am not worried. I do what I have to do. I've been there and we do the work. West
What
Central.
lesson you learned from?
We're not taking them for granted.
Yeah.
We know we have to do work and we're doing it.
So they felt that this St. Elizabeth, your previous constituency, they felt that you took them for granted. That was it.
Maybe some did, but I think sometimes you have to reconcile the work with presence, and some of it was presence. I was running all over the place in agriculture and so on, and even though some work was being done, some people never see it too much and they felt a little left out. Some of it may have been just a team effort. There's a team to do it. Some of it was the national swing. We lost the elections. So a combination of things, you know, but you learn from all of them and you believe in democracy, so you accept whatever the people throw at you.
Yeah. So why you never contest back the St. Elizabeth seat? Why you decided to move?
Yeah, you know that I lost by 13 votes.
Yeah, so why you never contest it? Why you never contest
I thought you
it?
said, I never did a recount.
Yeah, well,
Or contest after.
Yeah, like go back into the seat and try to be the MP again for that.
It's a long story, which you don't have time for. But as it turned out, we
we have our next 2.5.
we wish each other all the best. I wish the best for them, and I'm always available and assist. Floyd is there.
Yeah.
I have a good replacement, so.
And I mean,
no
politics
issues.
is such a grimy thing. Like, again, like, how do you even separate it? Because now I ask you, like, the question that you were asked about, you know, the cheating scandal with your wife. Like, how are you able to separate the minister from the private man? You know, Minister Tufton from just regular Dr.
Well,
Christopher.
there's actually a chapter in the book called the private lives of public men.
When we read it.
When we get our
But it's always hard. I mean, part of you belong to the public.
Yeah.
Because you put yourself out there and you make yourself into a public person. And some part of you, of course, you try to keep your private space. It's hard to balance the two.
Must be.
And you can get away with some things when you're a fully private person. Some other things not so easy.
Yeah.
But you know, these are decisions you make and you have to live with the consequences.
Yeah.
I've tried to live with all the consequences of my decision.
But you were accused
and they're not always good decisions. Eh?
Yeah, because you were accused of extramarital affair. Like,
Yeah, man,
wasn't
of
it?
course.
Yeah,
And as I say, we live, we aspire, we learn, and we strive to perfection, but rarely gets there. That sounds philosophical, the truth.
Yeah, and I want to ask, like, what was the follow-up from your wife?
Oh,
like,
Lord. You go too far, though. You go too far.
I'm pushing it. I'm pushing it.
If it is about me alone, I don't mind talking. But if it involves other people,
That's fine.
leave it alone, you know.
Anybody gets
But I care about all my family members and make sure that everybody is as good as ever. And as I say, you learn, you live and you learn, and you move on.
Do you feel like you've achieved most of the goals that you set for yourself as Minister of Health since 2016?
All or most, you say?
Yeah.
Most, to some extent, I've achieved, I think, or I want to pluralize it because we are a team.
Yeah, good.
I had a vision to try and get a buy-in to the lifestyle concept. When I took over, it was only the Ministry of Health, and I lobbied nicely the Honorable Prime Minister to add a wellness. Now, health really means wellness, but wellness for emphasis, because I wanted to push the lifestyle thing, which we did, and you know about that. I think there's a greater recognition, and we're testing it, around lifestyle. So things like exercise, nutrition. People are aware. Some people are trying it, some are not, even though they're aware. I think that's a good thing. And I think we need to play on that more in the future. I think the build out around health centers and the build out that's taking place with hospitals are big achievements. Some will go beyond this term because the buildings won't finish until the next year or 2 years in some cases. I hope I'll be around to see them and to help cut the ribbon, third term. But even if I'm not, which I'm not wishing for by any stretch, because I think we're the best government to go to the third term, it certainly brings me a lot of pride and comfort that I was able to, with the support of my government, Prime Minister and others, get to the point where we start things that can't be turned back. And that will augur well for the development and the expansion of the health portfolio. I think on the regional front, I'm very proud of the fact that Jamaica Moves became Caribbean Moves, adopted by CARICOM, being implemented in other Caribbean countries.
Nice.
We led that charge.
I wanted to ask you about, just to interject, was that change made due to it being somewhat tainted by the scandal of the market your involvement and connection to that?
You mean the move from Jamaica Move to Caribbean Move?
Yes.
No. It's a more relevant name. I mean, it was when we introduced it to CARICOM, which was at a CARICOM meeting in Montego Bay, I got permission to bring a paper there, having lobbied my health ministers, actually in Switzerland initially, about what we're doing in Jamaica. They bought into it right away, and we introduced it in Barbados. So we had Barbados Moves, St. Kitts and Nevis Moves, Trinidad did it, the minister at the time, and I think one other country. And then CARICOM decided to take it on under their umbrella. So we, CARFA initially, Caribbean Health Agency, got support, 250,000 US, I think, from CDB, Caribbean Development Bank, to hire a consultant to map out this concept based on Jamaica moves. And having done that, created a steering committee and got the region to buy into it. And then the Caribbean adopted it through CARICOM and are now driving it. So we were the ones who set the trend. We were the ones who supported and pushed it. The controversy,
Yeah.
I don't call it scandal, by the way.
Yeah, that's why I said quote unquote.
I call
Yeah,
it
quote
controversy.
unquote.
The controversy around the market me scenario was a distraction in terms of getting it into CARICOM, because there were some people who were asking questions, and about, whether or not this is a legitimate initiative,
Yeah, credible.
or who owns it, for example.
Program, yeah.
But it was always the intention to allow CARICOM to own it. I mean, I have no interest in owning it, and certainly Market Me didn't have any interest in owning it. But from my standpoint, it's a good thing. And having passed all of that, let me tell you something. When you're leading, you have to be prepared to deal with all sorts of slings and arrows. So for me, I'm stronger for it.
Yeah.
I'm stronger for it.
Did you feel like it was
I know my intentions are sincere.
Yeah. Do you feel it was somewhat undercut by, the controversy?
No, because we achieved the objective. I think that in Jamaica, it slowed it down for a while.
Yeah.
And that was unfortunate. Because let me tell you, when Jamaica Move started, it actually, for the first year or so, was self-funded. There was no government money put in Jamaica Moves.
Wow.
It was funded by, when we came up with a concept and initially pitched it, we pitched it to private sector interests and got support, sponsorship from private sector players. The government of the day never came in until about a year after in terms of government funding. By then it was...
I guess budgetary country, like you never factor in the budget.
Well, yeah, and just how it evolved. Because it never evolved in the ministry. It evolved external to the ministry, even though I was a part of that evolution with the ideas and the... it's a long story, but kind of complicated. Which is why I think there was really nothing there in terms of these inquiries and all that, because government funds never started the program. But people had their views for obvious reasons.
Yeah.
So, as I say, it is what it is. It's part of the process. And
So do you own, or who owns the trademark, or is it
no,
trademark
the
Jamaica Moves?
ministry owns Jamaica Moves,
Okay.
and CARICOM owns Caribbean Moves.
Okay.
There's no ownership, no private ownership.
Oh, okay.
We didn't up sue nobody, because remember you had threatened to sue or take legal action.
No,
against people.
we don't sue
These
nobody.
filthy
We
and
just-
scandalous claims.
We don't sue nobody. The court is one way to deal with things. The other way is just to manage the public's perception and the information that flows out there. And I am not so bad at the latter. So I deal with that. The communication, that is.
No, I was about to ask you. I mean, I feel like we have to wrap up now, but I just have to ask: do you think you being such a good marketer, or you think that you're a good marketer, that makes you an effective politician / minister?
I think that communication is essential to getting policy implemented. But communication does not determine good policy. So while I would say as a trained communicator, I have a slight advantage in understanding how to craft a strategy and drive a strategy. That's my training. Just as a doctor would have his training. I also have to invest a lot of time and effort in determining what's the best policy for the people that you serve. So I wouldn't attribute my strength solely to communication.
Take a sip of water. You can't say whenever you get
You gonna make the water bad.
Yeah, I make it bad. Take a sip. We'll give you water.
So I wouldn't attribute my strength solely to communication, because then that's the kind of mischief that some people try to push. You're just a PR man, but there's nothing behind it, type of thing. And I would never say that, even though I think communication is essential. And I make no
It's very
apologies.
key.
I have no apologies for that. But we have a team. I don't claim to be the sole source of ideas. I'm a big team player. And I'm not intimidated or shy, or I like people around me who can add value. So if you have talent and you can add to it, I'm not intimidated by that. So the more the merrier. And then when we decide we go. And I think I've worked with a good team at different levels in the ministry, in the government, and I've gotten a lot of support from the Prime Minister and the team. So when I come with a proposal, an idea, we have to interrogate it. That's how it works. But once we decide, I take it and I run with it.
Yeah. Okay.
Not the run with it that the other people them do, you know?
Yeah, other people them do.
It's very different. Yeah.
So recently we've seen where exotic animals are being smuggled into the country. Like the ocelot, which was the so-called cheetah. A cheetah them did say.
Yeah,
So the ocelot, squirrels and parrots. So I want to know, like, how much of a health risk is this to Jamaica?
It's a big health risk. In fact, I'm sorry to say again, but I shouldn't be sorry. Chapter 3.
Wild flavors.
You know why wild flavors is called wild flavors?
I was wondering.
Let me tell you, and many people ask that very question.
Yes.
Chapter 3 is titled Wild Flavors. And it's titled Wild Flavors because it gives a history of how most viruses are spread.
Wow.
And in the case of COVID, the strongest theory, there are two theories around COVID. One is about a lab development. The other one is about the wet markets in China,
Yes.
Yeah.
where wild meat is an exotic feature. And the wild meat people go and buy and consume different types of wild meat. And it is said that the virus jumped from bats to the humans. And that's how the virus started. And that tends to be that tends to be the more popular theory, even though the lab theory is another theory.
It has been growing more.
Yeah,
So
and I more believe the
in
lab.
that chapter, I identify a host of other viruses that jump from birds, bird flu, swine flu, a whole heap that jump from animals, bats to humans.
Yeah.
To answer your question,
Especially
the
mosquito.
chapter starts with someone who, and it's, we don't want to say who, we're not going to say who it is or anything like that. When I was Minister of Agriculture, put it another way, sorry, there were some wild animals smuggled into the country. And invariably, when we find them as agriculture, I have vet division under my watch, we would detain them. You're either you test them, and essentially, some of them you put to sleep, right?
Yeah.
And in this instance, a particular monkey was detained and had about 5-6 strains of a particular virus.
Oh my God.
And was put to
That's
sleep. So just to say it to you in real practical terms, it's a very dangerous thing.
Here I thought it was
Very,
just
very
drugs
dangerous.
they're smuggling.
No, wild animals
Exotic
smuggling
animals,
is a big thing along the south coast, apparently. So I hear. And it's easy to do because of these small traders that come and go. Because these exotic birds and exotic animals in South America and so on. But ideally, animals need to be tested before they are brought in. So the official trade to go to the zoo and so on, they have to be they are subjected to a lot of thing there.
Wow.
You know, the Zika virus is out of the Zika forest,
Yes.
which is a mosquito bit the monkey, then bite the man, and the virus jump from the monkey to
For
the
real?
man.
The monkey.
Yeah.
Always
a
them type of.
A mosquito
The monkey.
give us the
Yeah.
most. Yeah, mosquito.
So you have to manage
Yeah.
those things, and people don't understand the dangers it poses, but it does pose, which is why you have port health and port security that have to manage and manage those things.
No, I was saying I thought the wild animals were like them just did put drugs in them in some way. I don't know. I thought that was one
No,
of the-
not in this case.
Drugs
So what they call the wild meat, the exotic meat from the wet markets in China, they actually call it wild flavors. So that's all. So I decided to name the book Wild Flavors.
So like them eat. So it's like them would eat snake and
Yeah,
bunch
and I don't
of
want to. The
meats.
truth is that
Not even
there-
China, but
let me make it broader so as not to discriminate. There are many cultures
true.
that eat almost everything.
Yeah.
Some of them
Can't be like
including
Trump.
man.
Yeah.
Okay. So
The kung flu.
depending on which
China.
culture you subscribe to, you will be surprised. Everything is eaten.
True.
And some cultures that don't eat certain things at all.
Yeah.
Right?
Yeah.
So it is what it is. It's a cultural thing.
Yeah.
Yeah, one more question.
Yes, finally. This was on the projects. So there's a new administrative building for St. Anne Health Department that open in June on June 6th, and there's a 3.1 billion that was approved for 66 projects. So with all of these developments happening, there's been discussion about Portmore becoming a parish. Is there any plans in place to build a hospital, a type A hospital, to relieve the burden from other type A hospitals like KPH or
Spanish Town, just
Right.
no Spanish Town,
the closest one.
but another type A.
Oh, it's not type.
So, all right. So let me say this now. So, yes, there is a plan to do a hospital in the new Portmore Parish. Lands have already been identified in the Bernard Lodge area.
Wait, you said New Portmore Parish. That confirmed?
Well, it's not confirmed.
See the breaking news, you know.
No, it's not confirmed. As you know, there's a court stop.
Yes, there is.
But the court stop is more for consultations, not that it won't happen. So it's a
Okay.
delay as opposed to it not happening.
Okay.
When that will happen, then it's all of us have to decide that.
Okay.
But in any event, some of the critical infrastructure like hospital is slated for there. So there are lands identified for that. Whether it's a type A or type B is another thing, because how the hospital system works, with the expansion of KPH, the expansion of Spanish Town, which is between the two, and another one in the middle there, it could be a type B. It doesn't have to be a type A. And you just refer depending on what the services are, because there are a lot of additional services coming in Spanish Town. And if we build a new KPH, it will be a bigger type of facility. So that is to be determined. That's the point. I don't know for sure.
Yeah, because I was like, wouldn't it be better to have an additional type A?
Yeah, all the type A
Hospital
means
on the
is that it's
island.
offering some additional services.
Yes.
But it depends. I don't want to comment that it will until we get to that point. But there will have to be a facility.
I'd love to see that for Portmore.
And I mean, if you want it to be the new parish, I feel like everything should be premier, flagship,
you know?
type A in every way.
Import more.
Used to.
Yeah, me too.
Okay, I get it.
So we have all three of us have personal connections. to Portmore,
Portmore is
yeah.
a good place and
Yeah.
good people, and it's populated, and the expanded boundaries will make it even more so.
Yeah.
So it does require critical amenities. So yeah,
And I'm
the
gonna
government
build up
committed
some
to that.
nice house over there. Mighty God. Well, not one, but the developers are building.
Yeah,
some
yeah,
lovely
yeah,
Too
yeah, that's true.
expensive, but nice.
Oh, we have got to talk to that. That's Fernando Charles Housing.
No, Pernell is not housing. Housing bill is on the office of the Prime Minister.
Oh, under the office. So we have got to
Oh,
talk. So
okay.
please, can you make us talk to
NHD, you could talk to.
No, please
No,
make
we
us
don't want to
talk
talk
to the
yeah.
Prime Minister.
Yeah,
I'm sure you
Put
have
a good word in.
line with it.
No.
We're not too
I
sure
need to
about it.
know how I can afford a home.
Well, look at the tremendous opportunities through NHD. You can double
Yeah,
up with your
but-
partner, and you get the down payment and all that sort of
I
stuff.
feel like we have to go link Mr. Beast. Give a sub store and say, yo, Mr.
Whole heap
Beast
of
helps you.
possibilities. Whole heap of possibilities.
That's crazy. Minister Tufton, give thanks for joining us.
Yes.
Dr.
We did that well. Minister Dr. Honorable Christopher
Oh
Tufton.
Lord.
Give thanks. This was an endurance test to test your health and
Tell you,
wellness.
I can't believe I've been here for 3 hours.
Right?
Go to
You
3
really
hours.
have to throw 3 hours worth of talking. My
Yeah.
people get bored enough.
Yeah.
Speak cartels, really.
Yeah,
but
cartel,
We
yeah.
give thanks to you
Yeah,
for
man.
joining us, to sitting with us and
yes.
having a fulsome conversation.
Yes.
I will give thanks.
Appreciate
Thank you
it.
very
Thank
much, and good luck to all of you. And for those who are not yet enhancing the population count, please bear that in mind as you go forward.
You know, me did have one question about abortion, but I say,
give
you know,
me
me
a
not
you.
do that. Me not do that.
Just give
Me
me
not
a
do
you.
that.
Abort the mission.
Just give me
Alright.
a
Like, can we make it legal? Abortion?
You can't do anything. The question
Can
is
we
whether-
make it
is
legal?
whether or
Can
not.
we make it legal?
I'd say you
don't
can't do
know. I don't
anything.
know. I think we need to end the program.
How about that?
Give thanks. Where can the people follow you on the social media?
Yes.
Let them know.
Chris Tufton on Instagram, and I think it's the same for the other one too. Twitter.
X. It's X.
Yeah, I think it's the same. Chris Tufton.
And of course, follow the Ministry of Health and Wellness.
Ministry of Health and Wellness is moh.gov.jm. I think that.com.
I think we need to eliminate some
This
that.
is the only time I'll say Google it again.
Right?
Don't do it for the drill, but for everything else.
Gosh.
I think I that we left no stone unturned.
I don't think we did.
so.
Yeah.
All right, we'll both feed some unhealthy KFC. All right.
You want some, doctor?
What?
KFC.
I have to leave.
The green option, one of the green things.
But
salad.
KFC, I'm a friends, man. I'm a friends all the time.
Give thanks again, Minister. I that people, God.
Yes.
Well, thank you.